Namaskar and welcome to the 15th episode of Health4All, a weekly show on health and wellness with special focus on current topics of concern brought to you by Heal Foundation, India's top health communication organization. I am Shankar Raj, President of Heal Foundation, and today's topic of discussion is on COVID and its effects on cardiovascular health, preventive strategies. But before we move on to the show, let me remind that Health4All show is live streamed on YouTube and Facebook. We now have the show intro video. We now have the roundup of episode 14. We welcome you to session 1, which is on new emerging COVID variants. What should we know and how much? When will the coronavirus story actually end? And will we have to learn to live with it as flu as Spain has now declared? Will the world and India move towards a transition path from pandemic to endemic?
This would happen just the way that you just said. Spain has now decided we will have to live with it. live without fear. Like, in the Western world, flu has always been a killer. Even before, in India, we did not have that much of it. One, we did not have an aging population. Second, maybe epidemiologically, whatever we see is a very different situation in India. So, with the flu, also variants keep appearing every year. They keep tweaking the vaccine. But then people are dying, people are suffering still. But people have learned to live with it. There's no fear as such. So similarly, we will have to live with it. We still cannot predict. There's no crystal ball, where you can gaze and say this is going to be over and done with. Because the way new variants are emerging, it is very difficult to say. Right in the beginning, first meeting that we had in our college was with Dr. K.K. Agarwal. And we all were very optimistic that since SARS had died at 40, and this is from the same family of Coronaviridae, so at 40 degree, this is not going to survive, but it defied. So this is the problem with this virus. We still cannot predict definitely, but as of today, we can say that we will have to learn to live with it, learn to, tweak the vaccines, do whatever is needed, and we still cannot predict what's going to happen.
Dr. Salve, in an INS story published last month, you had said, to quote you, there is no COVID virus called Delmicron yet. Omicron is also no new virus as it is mutated coronavirus, unquote. Can you elaborate on this?
One more important thing, it is a context this statement was made was because there was a lot of queries we were getting regarding is this a new virus we are witnessing now, which is a combination of Delta and Omicron. So I need to sort of dispel this information with the correct information that all the RNA viruses, mostly they mutate and they mutate in a real-time manner. You see, they mutate on a weekly basis, actually. And it is an inherent property of the RNA viruses. The same thing is happening with the COVID viruses, SARS-CoV-2, what we are seeing the pandemic currently. And this mutation happens on real-time basis. And we, as a public health fraternity, as a surveillance of genetic surveillance, through genetic surveillance, we track these mutations. And we track this mutation in the two forms. One, the genetic mutation, that is a phenotype mutation happening in the virus. And second, what is the impact of this mutation on the community or in the population. So that's why we have various categories of viruses or the mutants currently. If we see how WHO classifies it, the variant of interest, the variant of concern, VOI and VOCs. So we have seen so far few variant of concerns. First variant was alpha, beta, gamma. It was there in a few pockets in African countries, and delta, which was again which was causing majority, which is driving current pandemic, particularly in the developed countries. And now we have the Omicron. So all these are the mutations, and there are a lot of mutations happening. So what you rightly said, and it rightly titled, how much we should know about the mutation. We should always know that whatever is there, the prevention and protection sort of techniques or strategies remains the same as far as the mutation is concerned. But yes, as a policymakers, as a epidemiologist, we need to track the mutations in order to see how the pandemic will go in the future conditions.
A recent study based on COVID war room data in Karnataka has shown that children were least affected. What are your views?
They've been doing a lot of clinical trials about the vaccinations that are going to be available for the kids below 10. So now, I personally, because I've come to Karnataka to do a project, basically a project implementation on COVID-19 vaccinations for the mobile population. So we're doing this drive for the truckers and for the female sex workers and the allied population, so on and so forth. So I really cannot, we've not got much information about this from the Karnataka state health authorities either. So yeah, I'm working very closely with JSI and the state health authorities in Karnataka, in Bangalore especially. So about this, we don't have that kind of concrete evidence as to what. Yeah.
What should common man know about this? All these emerging variants. You are a physician, so when common people come to you, are they alarmed, and how do you advise them? And what message do you give across to them?
Actually, I'm getting more of the people they are who are in some lower class. They are not having any idea about all the variants. but in the some higher socioeconomic status, they are having some pinch of ideas about the variant. But more or less, the majority of them have has no idea in our side.
So, sir, when you talked about COVID pills, sir, like starting from because most of these COVID pills are under emergency use authorization. So first, for particularly from a general public point of view, what would this mean, emergency use authorization, from their perspective, what they should understand about it? Second would be like so many guidelines and counter opinions coming on pills. So how much people should actually absorb and believe? Say in case of even you just spoke about molnupiravir, and that has started with remdesivir also earlier. When remdesivir started, WHO gave a different statement, and then now it is in regular practice by the practitioners are saying. So there's always also a clash of opinion between the researchers, scientists, and the practicing doctors who are seeing something else or some better benefits while they're treating patients, particularly when limited options are available, sir. What people should know about emergency use authorizations?
See, all drugs, normally a drug takes couple of years. Vaccines also take couple of years to work. So whether it is a drug or a vaccine, these are all early use and rapidly developed vaccines. Normally, if you see in the history of medicine, vaccines took 8-10 years to develop or 20 years to develop. Similarly, for any new therapy to come, it takes a couple of years to develop. So obviously, these are all repurposed drugs which have been used overnight. But the data generated, as I said, has been reasonably robust. And the new age pills which are coming in, whether it is the latest data on remdesivir, the latest data on molnupiravir, that is saving lives. See, we started with the story of hydroxychloroquine, ivermectin, and the early remdesivir days when there was no data. So we started with nothing, and only we found out that dexamethasone worked only in severe cases, and oxygen and prone position and nursing care. So that is how therapy evolves. So when we have a new disease which is evolving with new strains, obviously we will have new age agents. We have to choose the most vulnerable group. So for me, as a treating doctor, it's a very simple algorithm. Look, for lay people, they should go by their doctor's advice, because every patient is different and the profile of every patient is different. So if somebody is asymptomatic, is 85 years old, has just mild hypertension treated with one tablet, completely asymptomatic, CBC, CRP, nothing is needed. You just need observation. You need temperature monitoring and saturation monitoring. But the same 85-year-old has a little bit of kidney issue, has hypertension, diabetes, which is very high, probably, and is symptomatic with persistent fever of 100 and above, probably will need, if can be managed at home, an oral pill, or may need to go to a hospital and need an injection. So every case is different. For me, who is most likely to die? For me, every human life is important. So the idea of using these patients and these pills are in the most vulnerable groups. So saving that life in the vulnerable group who's likely to deteriorate definitely matters. And if there's data and evidence to show that it might be saving lives, and all these newer therapies definitely have data to show that at least in the Delta variant, they save lives. So if there's lung involvement, they save lives.
So we move on to the next session, which is why those not infected with COVID-19 should be extra careful. Despite the run of COVID virus, there are people who are not yet infected and they call themselves co-virgins. Do we really have such co-virgins, or is it that they might have got mildly infected with no symptoms, or they had a robust buildup of antibodies?
So first of all, you have already mentioned those who haven't had COVID, or rather I would say those who don't know that they have had COVID, and also the ones that are unvaccinated. That needs to be included in the same definition. Because say if you remember, say the third survey by ICMR that noted in certain urban centers, including Delhi, there were more than 2/3 of the population that had some sort of antibody against COVID back in early part of 2021. And this shot up to more than 90% once the vaccine came into being. So it's not that people get the natural immunity from a natural infection only, but also from vaccines. So other than these two, of course, there should be the immunocompromised individuals and those who are possibly on some immunosuppressive agents. They should also be part of this so-called co-virgin group, quote unquote.
So what is your view on this, like in opening up schools, and how much children are vulnerable?
As we know that children, they are a subset of population which are vulnerable. There is no doubt about this. And not only the current, most children, if they are exposed to COVID infection in acute conditions, most of them do pretty well. But apart from this acute infection, there is something called MISC or multi-system inflammatory syndrome in children, which can occur later on, which was quite evident with the Delta variant. We will have data about Omicron as well coming up later on. So it's very important to protect children. At no point it can be said that herd immunity should start with children. So we do not want any mortality whatsoever, whatever age group it be. And fortunately, children, they handle COVID very well. The data that we have got so far from our country and from Western countries as well. Having said that, there is a risk of developing severe infection later on as well in terms of MISC. Coming to the school reopening, I think most centers and most governments would be taking a very phased approach. So you can see children who can inculcate COVID appropriate behavior will be allowed to start schooling first as the schools reopen again. After in certain states there has already been closing down of schools. But in phased manner, I think things will start coming up. We do want children to go to school because that's a very important part of socialization. If children do not play the physical activities, this is going to hamper their overall health as well. We do not want that. At the same time, we want that this opening should be in a phased manner. Children who can follow COVID appropriate behavior should start first, and then as and when the government rolls out these vaccinations for children, accordingly, everyone can join in as well.
Welcome back. Our first session is Yoga for Heart Health. We have with us Ms. Divya Prakash, an accredited dietitian and nutrition counselor, a wellness therapist, deep sleep mentor, psychological counselor, and blogger. She has mentored many corporates, working individuals, homemakers, NGOs, students in colleges and schools through customized training sessions. She's a certified professional trainer accredited by MSME Technologies Development Center, Government of India. She's also working as coordinator and wellness expert of an artificial intelligence-based company, healthcare company headquartered in Australia. Welcome to the show. I think last time when we met Ms. Divya, I questioned you more about the sleep because I was fascinated by your deep sleep, this one, but I didn't know you are a yoga expert also. So this is your session. You can take time till about 8:50 and then take a couple of questions. Over to you, Ms. Divya Prakash.
Thank you, Mr. Shankar. Welcome you all to the yoga session of Health4All. As Mr. Shankar has mentioned, I'm Divya Prakash, dietitian and wellness therapist. In today's yoga session, based on health, yoga for heart, we will discuss about the importance of heart, factors that's affecting our heart health, and the practical solution, how to combat those problems. Okay, as you all know, heart is the organ that works continuously throughout the day without taking rest. While we asleep, then also our heart works. Just imagine The moment your heart stops, you are dead. धड़कन रुकी और जीवन रुकी. So it's our heart is basically responsible. It's the most vital organ of our body and responsible for pumping blood throughout the body. So it's very crucial for us to take proper care of our heart. But आज के life में because of our sedentary lifestyle, poor eating habits, and poor sleeping habits, we have destroyed our whole body and especially our heart. इसके अलावा हमारे जो लाइफ में और भी प्रॉब्लम्स है जो कि I can say because of lifestyle disease like hypertension, diabetes, obesity, ये सारे भी जो प्रॉब्लम है वो हमारे हार्ट को बहुत ज्यादा अफेक्ट करते हैं. ये तो सारी प्रॉब्लम्स की बात है. हम इसके लिए क्या कर सकते हैं? योगा, आज के सेशन जो कि योगा पर बेस्ड है, योगा इज वेरी हेल्पफुल एंड यूजफुल फॉर कीपिंग योर हार्ट हेल्दी. योगा is a study of life. It balances your body and your mind. हमारे लाइफ में sedentary lifestyle में it's really difficult for us to keep away ourselves from stress. एक छोटे बच्चे के पास भी स्ट्रेस होता है. किसी ना किसी चीज का स्ट्रेस सबके पास 24 hours है. But we are running behind, I don't know for what we are running behind. भागते जा रहे और वो हमारे लाइफ में स्ट्रेस ला रहा है. स्ट्रेस इज वन ऑफ द मेन रीजन जिसके कारण हम ठीक से हमें नींद नहीं आती है, हम सो नहीं पाते हैं, हम अपने टाइम को मैनेज नहीं कर पाते हैं. उसके कारण हमारी सेडेंटरी लाइफस्टाइल हो रही है. एंड सेडेंटरी लाइफस्टाइल का दूसरा एक और भी रीजन है, हमारे पास ओवर अ पीरियड ऑफ टाइम हमारी अफोर्डेबिलिटी बढ़ चुकी है. हम चीजों को बाय कर सकते हैं. हमारे पास बहुत सारे एडवांसमेंट, टेक्नोलॉजिकल एडवांसमेंट आ चुके हैं. हम काफी कंफर्टेबली अपने घर में रह सकते हैं. हर चीज के लिए हमारे पास एक गैजेट होता है. इंटरटेनमेंट के लिए मोबाइल, टीवी, एवरीथिंग इज देयर. जो चीज चाहते हैं वाईफाई, इंटरनेट के थ्रू हमारे पास आ जाता है. और इस ओवरऑल पूरे बार्गेन में हमारी लाइफ सेडेंटरी होती चली जा रही है विदाउट रियलाइजिंग कि इसके साइड इफेक्ट्स क्या है. हमारे बहुत ही कॉमन हो चुकी है स्पेशली हाइपरटेंशन, डायबिटीज एंड ओबेसिटी. इंडिया में ऑलमोस्ट आज के डेट में 60% पीपल ओबेसिटी है. ओबेसिटी अदर फैक्टर्स से ज्यादा हमारी अपनी लाइफ स्टाइल के कारण है. अब इन सारी चीजों को प्रॉब्लम के बारे में तो हम बात कर रहे हैं, और जो हमारा ये सेशन है योगा फॉर हार्ट, उसमें हम अपने हार्ट के लिए व्हाट वी कैन डू, योगा कैसे इस पूरे प्रॉब्लम को सॉल्व कर सकता है. योगा करने से स्पेशली फॉर हार्ट की अगर हम बात करेंगे, इट लोअर्स योर ब्लड प्रेशर, इट इनहेंसेस योर लंग कैपेसिटी, इट इंक्रीजेस योर ब्लड सर्कुलेशन, इट कीप्स यू अवे फ्रॉम स्ट्रेस. ओके, इट reduces your blood cholesterol level. बहुत सारे योगा के एडवांटेजेस हैं जो कि आपके हार्ट को हेल्दी रखने में हेल्प करते हैं. तो आज के इस प्रैक्टिकल सेशन में मैं आपको बताऊंगी बहुत बेसिक टेक्निक योगा के, कि जैसे योगा शुरू करने से पहले हमें क्या क्या करने चाहिए. योगा के कुछ बेसिक टिप्स बताऊंगी जो कि आई कैन से दीज आर द गोल्डन रूल्स ऑफ योगा. उसके बाद हर एक योगा सेशन से पहले हमें वार्म अप जरूर करना चाहिए, क्योंकि वार्म अप उस करने से हमारा बॉडी और माइंड रिलैक्स होता है, हमारे मसल और जॉइंट्स रिलैक्स होते हैं. आपने जनरली नोटिस किया होगा जो लोग योगा को प्रैक्टिस करते आ रहे हैं कि आप जब शुरू के दौर में योगा शुरू करते हैं तो आपके बॉडी में किसी पर्टिकुलर पार्ट में आप पेन डेवलप कर लेते हैं और आप अपने को डिस्करेज पाते हैं कि नहीं, आई कैन नॉट कंटिन्यू विथ माय योगा सेशन क्योंकि हमें प्रॉब्लम हो गई है. इसका मेन रीजन है कि प्रॉपर वार्म अप नहीं होने के कारण हम अपने बॉडी को इंजर कर लेते हैं. ओके, तो वार्म अप के बाद मैं आपको 10 योगा सेशंस, योगा आसनास बताऊंगी जो कि आप एक सीक्वेंस में करेंगे तो ये आपके हार्ट के लिए बहुत ही ज्यादा इफेक्टिव होगा. आफ्टर दैट I will tell you about the Surya Namaskar. मेरी कोई सेशन सूर्य नमस्कार के बिना खत्म नहीं होती है. आई से सूर्य नमस्कार इज द सोल ऑफ योगा. इसके बहुत सारे एडवांटेजेस है. सूर्य नमस्कार के बाद मैं आपको प्राणायाम के बारे में बताऊंगी. प्राणायाम यानी कि ब्रीदिंग एक्सरसाइजेस. हालांकि हार्ट पेशेंट सारे ब्रीदिंग एक्सरसाइजेस नहीं कर सकते हैं. जैसे आपने सुना होगा भस्त्रिका, कपालभाति. ये जो 2 ब्रीदिंग एक्सरसाइजेस होते हैं वो हमारे जो हार्ट पेशेंट होते हैं जिनको हाई ब्लड प्रेशर का प्रॉब्लम होता है उन्हें नहीं करना चाहिए. और लास्ट में मैं आपको रिलैक्सेशन के लिए शवासना के बारे में बताऊंगी. तो ये हमारे प्रैक्टिकल सेशन का होगा. एक सीक्वेंस में हम जाएंगे, लेकिन सबसे पहले हम बात करेंगे गोल्डन रूल्स ऑफ योगा. एक लोग कहते हैं कि योगा हमें सिर्फ मॉर्निंग में करना चाहिए, पर लाइफ हमारी इतनी चेंज हो चुकी है. हमारी आई कैन से बहुत लोगों को मॉर्निंग में ऑफिस जाना होता है या उनकी नाइट शिफ्ट होती है, तो दे आर नॉट एबल टू मैनेज देयर टाइम इन मॉर्निंग टू प्रैक्टिस योगा. इसके लिए आप योगा इवनिंग में भी कर सकते हैं, दिन के दूसरे टाइम में भी कर सकते हैं, बट यू मस्ट कीप दिस थिंग इन माइंड. गिव वेट at least an hour or more than that after eating to practice or start your yoga session. This is the first rule. Second, keep yourself hydrated, properly hydrated before practicing yoga. But don't drink too much of water. If you will drink too much of water while doing any asanas like you are bending, you will feel uncomfortable. Thirdly, wear loose, comfortable clothes and breathable clothes for practice. Fourth rule is like use mat or आसन. प्राणायाम के लिए आप कोई भी उलन आसन यूज कर सकते हैं, बट if you are practicing asanas, your mat should be sticky and cushiony. Sticky का मतलब है कि आसन करने में अगर आपने पैर को अपने ब्रॉड किया और कोई एक्सरसाइज आसन कर रहे हैं, प्रैक्टिस कर रहे हैं, तो आपका पैर स्लिप नहीं करना चाहिए. एंड कुशन का है कि जब आप लेट करके आसन कर रहे हैं तो आपके बैक को कंफर्ट मिले और आपको डिफिकल्टी नहीं हो. उसके अलावा एक और रूल है, वेरी बेसिक रूल, की जब भी आप सुनते होंगे कि ब्रीदिंग इज वेरी इंपॉर्टेंट, इनहेलेशन एंड एक्सहेलेशन. तो कभी आपको इनहेल करना है, कभी आपको एक्सहेल करना है, ये आपके लिए जानना बहुत जरूरी है. जब भी आपका बॉडी एक्सपैंड करता है, लेट्स सपोज आपने अपने हैंड्स को अप किया, पीछे किया, दैट टाइम बॉडी आपका एक्सपैंड हो रहा है. एट दैट टाइम यू आर सपोज टू इनहेल. और जब भी आपका बॉडी कॉन्ट्रैक्ट हो रहा है, जैसे आप नीचे की तरफ बेंड कर रहे हैं, तो उस समय आपको एक्सहेल करना चाहिए, अपने सांसों को बाहर की तरफ छोड़ना चाहिए. ये एक बहुत ही सिंपल सा रूल है, पर आपको हमेशा माइंड करना चाहिए. पर कभी कभी होता है प्रैक्टिस करते समय आप कंफ्यूज हो जाते हो कि अभी इनहेल करना है या एक्सहेल करना है. उस समय प्लीज डोंट स्टॉप ब्रीदिंग, डोंट ट्राई टू कंट्रोल योर ब्रीथ, जस्ट ब्रीथ. जिसमें भी आप कंफर्टेबल फील करते हैं उस वे में आप ब्रीथ करो. डोंट स्टॉप योर ब्रीथ. योगा में मेनली है, सबसे इंपॉर्टेंट है टू कीप ब्रीथिंग. ओके. और दूसरी एक और बात है, ऑलवेज ब्रीथ विथ योर नोज अनलेस इट्स मेंशन्ड अदरवाइज, कि आपको इस पर्टिकुलर देयर आर फ्यू प्राणायाम्स जिसमें आपको बोलते हैं मुंह से सांस लेना है, अदरवाइज यू शुड ब्रीथ थ्रू योर नोज ओनली. उसके अलावा एक और गोल्डन रूल है कि बहुत सारे ऐसे आसन होते हैं जिसमें आप अपने बॉडी के बोथ साइड को यूज करते हैं, राइट साइड एंड लेफ्ट साइड. अगर ऐसी कोई सिचुएशन है तो ऑलवेज ट्राई टू प्रैक्टिस योर राइट साइड फर्स्ट एंड देन गो टू योर लेफ्ट साइड. हर एक आसन में आपको रिलैक्स होना, अपने आप को रिलैक्स करना है. डोंट बी इन हरी कि मुझे जल्दी से करके अपने आसन को कंप्लीट करना है, अपने सेशन को कंप्लीट करना है. रिलैक्स कीजिए हर एक आसन में, स्लाइटली स्लोली आप ब्रीथ कीजिए, आपको बहुत अच्छा फील होगा और योगा का मैक्सिमम बेनिफिट होगा. योगा आसन करते समय आपने अपने सोशल मीडिया पे बहुत सारे एड्स देखे होंगे कि लर्न योगा फ्रॉम गोल्ड मेडलिस्ट, और उनके जो आसन होते हैं वो बहुत ज्यादा डिफिकल्ट होते हैं. स्पेशली एड्स में, तो आप उसको जब देखते हैं डिस्करेज होते हैं कि इतना डिफिकल्ट आसन कैसे करेंगे। दोज आर वेरी एडवांस्ड आसन। आपके हेल्थ के लिए बेसिक, बहुत सारे बेसिक आसन होते हैं जिसे आप इजीली कर सकते हैं, पर इन आसन को भी करते समय ऐसा जरूरी नहीं है कि शुरू के फेज में ही आप उसको परफेक्शन के साथ कर सकेंगे। स्लोली एंड ग्रेजुअली ओवर अ पीरियड ऑफ टाइम विद प्रैक्टिस यू कैन डू मास्टरी फॉर दैट पर्टिकुलर आसन। तो जितना आप बेंड कर सकते हैं, जितना आप स्ट्रेच कर सकते हैं, उतना ही करें। पेन के बियॉन्ड कभी ना करें, अपने बॉडी के सिग्नल को जरूर सुने। ओके, दीज आर फ्यू बेसिक योगा टिप्स। वन मोर बेसिक टिप्स कि ऑलवेज अपने आप डीप ब्रीदिंग करें। सांस को लेते समय और छोड़ते समय, अंदर इनहेल करते समय गहरी सांस ले और धीरे से उस सांस को छोड़े, एक्सहेल करें। ऐसे प्रैक्टिस करने से, इनहेलेशन और एक्सहेलेशन से आपका बॉडी और माइंड में कामनेस आएगा, आपकी एनर्जीज रेगुलेट होगी, आपका स्ट्रेस दूर होगा। तो ये कुछ गोल्डन रूल्स है योगा के। अभी मैं आपको कुछ आसन के बारे में बताऊंगी। सबसे पहले, जैसा कि मैंने आपको बताया है कि कोई भी योगा आसन शुरू करने से पहले हमें वार्म अप जरूर करना चाहिए। तो अभी आई बिलीव कि आप सभी मेरे साथ योगा करने को तैयार हैं, अपने अपने योगा मैट के साथ। तो सबसे पहले हम वार्म अप शुरू करते हैं। ये हमारा प्रैक्टिकल सेशन है। वार्म अप के लिए हम अपने बॉडी को फ्रॉम नेक टू टो वार्म करेंगे। पहले हम अपने सारे मसल्स और जॉइंट को रिलैक्स करेंगे। तो सबसे पहले हम नेक से शुरू करते हैं। फर्स्ट जो वार्म अप एक्सरसाइज होना चाहिए, दैट शुड बी नेक रोल। नाम बता रहा है नेक रोल, बट ये हमें याद रखना है। मैं आपको साथ साथ बता रही हूँ, हम जो गलती करते हैं हमें नहीं करनी चाहिए उसके बारे में। नेक रोल डजंट मीन टू रोटेट योर नेक। यू शुड नेवर प्रैक्टिस दिस। नेक रोल का मतलब है कि फर्स्टली टेक अ डीप ब्रेथ, इनहेल and move your neck backward, like. Then exhale and bring your chin towards your chest. Then again inhale and exhale. Inhale and exhale. इसके बाद हम एक बार जैसा बताया राइट साइड को पहले करते हैं। जब हम राइट साइड के तरफ ट्विस्ट करेंगे तो हमें एक्सहेल करना है, और जब हम सेंटर में अपने नेक को लाएंगे तो हमें इनहेल करना है। तो शुरू करते हैं, 3 राउंड हम करेंगे। एक्सहेल, इनहेल, एक्सहेल, इनहेल, एक्सहेल, inhale. Now exhale, inhale, exhale, inhale, exhale, inhale. उसके बाद नेक के बाद हम शोल्डर रोटेशन एंड ट्विस्ट करेंगे। इसके लिए हम अपने दोनों हाथों को अपने शोल्डर पर रखेंगे और हैंड्स को अपने बीच में ज्वाइन करेंगे। आप जितना ज्वाइन कर सकते हैं उतना ठीक है, अपने को स्ट्रेच नहीं करना है जरूरत से ज्यादा। उसके बाद हम अपने हाथों को पहले सामने की तरफ रोटेट करेंगे। 2, 3, 4 एंड 5। उसके बाद हाथों को रिलैक्स करते हुए हम पीछे की तरफ रोटेट करेंगे। 1, 2, 3, 4 एंड 5। शोल्डर रोटेशन के बाद हम अपना हैंड रोटेशन करेंगे, अपने हाथों को रिलैक्स करेंगे। उसके लिए एक हाथ को, लेफ्ट हैंड को हम अपने वेस्ट पे रखते हैं, राइट हैंड को पहले हम सामने की तरफ रोटेट करेंगे 5 टाइम्स। 2, 3, 4, 5। उसके बाद हम पीछे की तरफ ले जाएंगे। 1, 2, 3, 4, 5। फिर हम अपने लेफ्ट हैंड को रोटेशन में लाएंगे, पहले सामने की तरफ 1 2 3 4 5, फिर पीछे की तरफ 1 2 3 4 एंड 5। अब दोनों हाथों को हमारे पास है, अब हमारा एल्बो, एल्बो को पहले हम राइट एल्बो को अपने लेफ्ट हैंड से पकड़ेंगे और उसे अपने चेस्ट की तरफ प्रेस करेंगे, दिस इज कॉल्ड एल्बो प्रेस। फिर हम अपने लेफ्ट हैंड को अपने राइट हैंड से पकड़ेंगे और उसे अपने चेस्ट की तरफ लाएंगे। ओके, आफ्टर दैट वी विल डू wrist circle motion. Firstly, we will do in clockwise direction, then in anti-clockwise direction. 1 2 3 4 5. 1 2 3 4 5. अब हम डाउनवर्ड पोजीशन में जाएंगे और हम बैरल मूवमेंट करेंगे। इट्स वेरी सिंपल, अपने पैरों को थोड़ा सा खोलें और पहले हम क्लॉकवाइज मूवमेंट करेंगे, फिर एंटी क्लॉकवाइज, राइट साइड से करेंगे 1 2 3 4 and 5. After that, anti-clockwise 1 2 3 4 and 5. After that, we will do torso twist. Torso twist के लिए हमें क्या करना है, अपने हाथों को खोलेंगे और पहले हम दाहिनी साइड अपने राइट साइड में ट्विस्ट करेंगे अपने टॉर्सो को, और टॉर्सो को ट्विस्ट करते समय हमें एक्सेल करना है और जब सेंटर में आएंगे तो हमें इनहेल करना है। फिर हम अपने लेफ्ट साइड में एक्सेल करते हुए जाएंगे एंड राइट साइड में सेंटर में आकर इनहेल करेंगे। फिर उसके बाद हम वाटर व्हील मूवमेंट करेंगे। बहुत सिंपल है, अपने पैरों को थोड़ा पास लाए, हाथों को ऊंचे ले जाए, पीछे की तरफ थोड़ा जाए और नीचे की तरफ सामने की तरफ जितना झुक सकते हैं झुके। दिस इज वाटर व्हील। हमने अपने आधे पार्ट को रिलैक्स कर लिया, अब हम नीचे आते हैं, उसके लिए है नी बेंड। पहले हम राइट नी को अपने पकड़ेंगे और उसे ऊपर की तरफ प्रेस करेंगे अपने चेस्ट की तरफ, उसे नीचे छोड़ेंगे, फिर अपने लेफ्ट नी को पकड़ करके हम करेंगे, हमने रिलैक्स किया अपने नी को। उसके बाद लास्ट हमारा है एंकल रोटेशन। एंकल रोटेशन के लिए अपने आप को बैलेंस करेंगे, पहले हम राइट लेग पे खड़े होंगे, अपने लेफ्ट लेग को क्लॉकवाइज और एंटी क्लॉकवाइज डायरेक्शन में 5 टाइम रोटेट करेंगे। जिन लोगों ने ये प्रैक्टिस नहीं की है उन्हें शुरू में थोड़ा प्रॉब्लम होगा, पर विद पीरियड ऑफ टाइम आप कंफर्टेबल और अपने को बैलेंस कर सकेंगे। तो पहले हम करेंगे 1 2 3 4 5, 1 2 3 4 5। फिर लेफ्ट लेग पे खड़े होके हम राइट लेग पे करेंगे 1 2 3 4 5, 1 2 3 4 5। इस तरह से थोड़े से टाइम में 4 to 5 मिनट्स में पहले हम अपने बॉडी को वार्म अप करेंगे और हम अपने नेक्स्ट राउंड आसन्स की तरफ जाएंगे जो कि हार्ट हेल्दी होते हैं। बहुत सारे आसन्स हैं जो हमारे हार्ट के लिए बहुत हेल्दी होते हैं, पर जो योगा का एक रूल है कि वी शुड नॉट प्रैक्टिस ऑल द आसनाज। हमने किसी को देखा और उसे कॉपी नहीं करना चाहिए, क्योंकि हर एक आसन के कुछ कॉन्ट्राडिक्शन होते हैं और उनको जानने के बाद ही हमें वो प्रैक्टिस करना चाहिए। यहाँ पर मैं आपके लिए 10 आसन्स मैं आपको बता रही हूँ जो आपके हार्ट के लिए बहुत हेल्दी है। अभी मैं सिर्फ आपको हर एक आसन के 3-3 रिपीटेशंस बताऊंगी। आप चाहे तो इसे अपने घर पे 5 से 10 बार अगर इसे इंक्रीज करके करेंगे तो आपके लिए बहुत ही फायदेमंद होगा। सबसे पहले मैं आपको बता रही हूँ तड़ासना। तड़ासना और माउंटेन पोज, इसे कैसे करते हैं ये बहुत ही सिंपल है। आप अपने पैर को थोड़ा सा खोलते हुए खड़े हो जाइए, अपने हाथों को इनहेल करते हुए दोनों हाथों को ऊपर की तरफ लेकर के जाइए, छोड़ते हुए खड़े रहिए, गहरी सांस लीजिए इनहेल और एक्सेल करते हुए अपने हाथों को अपने बगल में लाइए। दिस आसन इज वेरी इफेक्टिव। इससे आपका वर्टिबल कॉलम स्ट्रेट रहता है और जो आपकी पोस्चर की डिफॉर्मिटीज होती है ओवर अ पीरियड ऑफ टाइम, आप जो रॉन्ग पोस्चर में बैठते या खड़े होते हैं, आपके वर्टिबल कॉलम को स्ट्रेट करने में और आपके चेस्ट को एक्सपैंड करने में यह आसन बहुत हेल्पफुल होता है। सेकेंड राउंड में कर रही हूँ। इनहेल, एक्सहेल, इनहेल, एक्सहेल। ये तड़ासना के बाद हम दूसरा आसन करते हैं वृक्षासन। वृक्षासन भी आपके लिए बहुत ही अच्छा है। ये आपके बॉडी में एक बैलेंस लाता है। आप जब इस आसन को करेंगे तो बैलेंस लाएगा, माइंड आपका काम होगा, क्योंकि स्ट्रेस एक बहुत ही बड़ा रीजन होता है आपके हार्ट इश्यूज के लिए। आपने देखा होगा तनाव, जब भी आपकी तनाव बढ़ जाती है, आपका ब्लड प्रेशर बढ़ जाता है, बहुत सारी चीजें इफेक्ट होती है। तो इस तरह से कामिंग इफेक्ट देता है, आपके चेस्ट को ओपन करता है, हार्ट को ओपनिंग का ये काम करता है। तड़ासना, वृक्षासना के लिए हमें क्या करना है? आपको अपने पैर पे सबसे पहले अपने आप को बैलेंस करना है और इसके लिए थोड़ी सी प्रैक्टिस लगेगी, कुछ दिनों की प्रैक्टिस लगेगी। सबसे पहले आप दाहिने पैर पे, राइट लेग पे खड़े होइए बैलेंस होकर के। लेफ्ट लेग को अपने उठाकर अपने थाइस पर आप इस बैलेंस कीजिए और अपने हाथों को उठाते हुए जोड़ करके काउंट कीजिए मन में। आप 2, 3, 4, 5। चेहरे पर अपने मुस्कान, स्माइल बना के रखिए। फिर आप अपने पैर को नीचे कीजिए। फिर इसी तरह आप राइट लेग को उठाकर अपने लेफ्ट लेग के थाई पर रखिए और गहरी सांस लेते हुए हाथों को ऊपर ले जाइए, अपने आप को बैलेंस कीजिए। फिर आप अपने आप को नीचे कीजिए। आप इस काउंटिंग को बढ़ा सकते हैं अपने आप की जितनी जैसे जैसे प्रैक्टिस होगी आप इसे ज्यादा देर तक होल्ड कर सकते हैं। वृक्षासना के बाद जो एक बहुत इंपॉर्टेंट आसन है, जो कि आपके हार्ट ओपनिंग के लिए बहुत इंपॉर्टेंट है, ब्लड सर्कुलेशन के लिए, बैलेंसिंग के लिए, दैट इज त्रिकोण आसन, जिसे ट्रायंगल पोज भी बोलते हैं। इसके लिए अपने पैरों को आप अपने कमर से, अपने हिप पोर्शन से ज्यादा खोलें और उसके बाद थोड़ा सा आपको ब्रेथ का कंट्रोल करना है। अपने दोनों हाथों को फैलाएं और सबसे पहले अपने बाएं हाथ को नीचे की तरफ ले जाते हुए गहरी सांस लेंगे। इनहेल करते हुए हम नीचे की तरफ जाएंगे और इनहेल करते हुए अपने दाहिने हाथ को साथ में सीधा करते हुए अपने गर्दन को टिल्ट करके हम दाहिने तरफ से अपने हाथ की हथेलियों को देखेंगे। इस तरह से हम अपने आप को होल्ड करेंगे, मन में काउंट करेंगे 5 तक। उसके बाद धीरे से एक्सहेल करते हुए हम अपने आप को बैलेंस करके फिर से सेंटर में लाएंगे। दूसरे तरफ करेंगे हम, ये दोनों साइड के लिए होती है। अब हमें गहरी सांस लेते हुए दाहिनी तरफ झुकेंगे और बाएं हाथ को ऊपर की तरफ रखते हुए अपने गर्दन को बाएं तरफ टिल्ट करके हम अपने हाथ को देखेंगे। मन में काउंट करेंगे 5 तक और फिर धीरे से एक्सहेल करते हुए हम खड़े हो जाएंगे। हम एक बार और इस आसन को करेंगे ताकि आप क्लियर हो जाए। इसमें एक चीज और ध्यान रखना है, जब हम इनहेल करते हुए अपने बॉडी को किसी भी डायरेक्शन में नीचे करते हैं तो आप देखिए कि ये मेरा जो टॉर्सो है वो अर्थ के पैरेलल है। तो हमें कोशिश करनी चाहिए इस आसन को परफेक्टली करने के लिए अपने टॉर्सो को हम पैरेलल रखें अपने अर्थ के। इनहेल करते हुए और दाहिने हाथ को ऊपर देखने के लिए हम अपने नेक को दाहिनी तरफ देखेंगे, मन में 5 टाइम्स काउंट करेंगे और फिर एक्सहेल करते हुए हम सेंटर में आएंगे। इसी तरह हम राइट साइड फिर से झुकेंगे, राइट हैंड से अपने राइट लेग को टच करेंगे और लेफ्ट हैंड से ऊपर देखेंगे, स्ट्रेट करते हुए स्काई की तरफ देखेंगे और एक्सेल करते हुए हम सेंटर में आ जाएंगे। वृक्षासना के बाद जो एक आसन है दैट इज वीरभद्रासन। इसे वॉरियर पोज भी कहते हैं। इस आसन के लिए हम अपने पैरों को खोलेंगे, अपने दाहिने पैर को आगे लाएंगे, हम ऐसे खड़े होंगे और अपने दाहिने पैर को हम 90 डिग्री पे रखेंगे और बाएं पैर को इसके 90 डिग्री पर रख करके हम अपने नी को अपने एंकल के पैरेलल ला करके अपने हाथों को उठाते हुए दोनों हाथों को जोड़ेंगे और इनहेल करते हुए हम इस तरह का पोस्चर बनाएंगे। इस गहरी सांस लेने की क्रिया में आपका हार्ट ओपन होता है, आपके बॉडी में बैलेंस आता है और आपकी स्ट्रेस रिलीव होती है। आप फील करेंगे कि कामिंग इफेक्ट आपके बॉडी में आ रहा है। एक्सेल करते हुए आप नॉर्मल आएंगे। आप दूसरे पैर से करेंगे फिर से इसे। अभी लेफ्ट लेग को सामने रखते हुए राइट लेग को पीछे ले जाएंगे। राइट लेग आपका स्ट्रेट रहेगा, लेफ्ट लेग 90 डिग्री के एंगल पर आएगा। इनहेल करते हुए आप अपने हाथों को ऊपर ले जाइए और एक्सेल करते हुए अपने आप हाथों को नीचे छोड़िए। एक बार हम और करेंगे इस आसन को, वीरभद्रासन। आप सब मेरे साथ प्रैक्टिस कर रहे हैं और कोशिश कीजिए आप इसे परफेक्टली कर पाएंगे। अपने दाहिने पैर को आगे लाएं, बाएं पैर को 90 डिग्री पे करें। आई होप आप पैर मेरा देख पा रहे हैं। और उसके बाद गहरी सांस लेते हुए अपने घुटनों को बेंड करते हुए गहरी सांस लेते हुए दोनों हाथों को ऊपर की तरफ ले जाएं। एक्सेल करते हुए इसे नीचे की तरफ लाएं। फिर दूसरे तरफ अगर हम बॉडी के दोनों साइड से कर रहे हैं तो हमें इक्वल प्रोपोर्शन में करना चाहिए। अगर हमने 2 टाइम्स राइट लेग पे किया तो 2 टाइम्स लेफ्ट लेग पे भी करेंगे। लेफ्ट लेग को आगे रखा, राइट लेग पीछे लिया, 90 डिग्री की एंगल पे डाला और अपने नी को बेंड किया एंड इनहेल करते हुए हाथों को ऊपर ले गए। इसके बाद है उत्कटासन और चेयर पोज। इसके लिए है ये आपके बॉडी में बैलेंस लाता है, आपके सर्कुलेशन को बढ़ाता है। इसके लिए हमें बैठने के लिए चेयर के पोस्चर में हम ऐसे बैठेंगे और गहरी सांस लेते हुए हाथों को ऊपर ले जाएंगे। एक्सेल करके वापस आएंगे, फिर गहरी सांस लेते हुए हाथों को ऊपर ले जाएंगे चेयर पोज बैठते हुए। आपकी स्पाइन सीधी होती है, इसमें वर्टिब्रल कॉलम, चेस्ट ओपन होता है आपका। इसके बाद आप फील करेंगे हम करेंगे मार्जरी आसन और कैट पोस्चर। इसके लिए हम जमीन ऐसे अपने वज्रासन में बैठेंगे, अपने हाथों को नीचे लेकर के नीचे करेंगे और गहरी सांस लेते हुए अपने बैक को ऊपर की तरफ करेंगे। फिर सांस छोड़ते हुए एक्सेल करते हुए हम नॉर्मल आएंगे। फिर एक डीप गहरी सांस लेंगे, इनहेल, एक्सेल। इसके बाद हम करेंगे सेतु बंधन आसन। इस आसन के लिए हम जमीन पर लेट जाएंगे, अपने घुटनों को बेंड करेंगे और अपने हाथों से अपने एंकल को पकड़ेंगे और अपने पेल्विक एरिया को ऊपर उठाएंगे। सांस छोड़ते हुए नीचे आएंगे, फिर सांस लेते हुए हम अपने पेल्विक एरिया को ऊपर करेंगे, फिर छोड़ते हुए हम नीचे आएंगे। इसके बाद एक आसन है जिसे बोलते हैं सेतु बंधनासन। अब हम करेंगे अर्धमध्य आसन। ये बहुत ही इजी और बहुत ही अच्छा है, जिससे दोनों चेस्ट आपकी ओपन होती है। सबसे पहले लेफ्ट लेग को हम अपने हिप एरिया के पास लाएंगे, राइट लेग को क्रॉस करेंगे और अपने राइट हैंड को अपने लेफ्ट राइट लेग पर रखकर अपने नेक को पीछे की तरफ घुमाएंगे और बाहर करते हुए जैसा मैंने बताया है आप एक्सहेल करेंगे, फिर आप सेंटर में आते हुए इनहेल करेंगे। इसी तरह हम दूसरी तरफ से करेंगे। अपने राइट लेग को अपने लेफ्ट हिप के पास लाकर लेफ्ट लेग को अपने राइट नी के पास लाएंगे। अपने लेफ्ट फीट पर रख करके राइट हैंड को पीछे की तरफ ला करके हम पीछे की तरफ देखेंगे। और लास्ट जो आसन है दैट इज पश्चिमोत्तासन। यह आसन हार्ट के लिए बहुत ही अच्छा है क्योंकि जब इस आसन में हमारा चेस्ट जो है हमारे हार्ट के नीचे आता है, प्रॉपर सर्कुलेशन आता है, कामिंग इफेक्ट आता है और हार्ट बीट को रेगुलेट करता है, रेस्पिरेशन को स्लो करता है। ये थोड़ा डिफिकल्ट है पर बहुत ज्यादा नहीं है। अगर आप ये पूरा झुक नहीं पाते हैं एक्सहेल करते हुए तो आप अपने नी को थोड़ा सा बेंड कर सकते हैं शुरुआत में। बाद में प्रैक्टिस से आप अपने हैंड से अपने नी को टच कर सकते हैं नेक से। जस्ट कोशिश कीजिए इनहेल करते हुए, इनहेल किया हमने हाथ ऊपर किया और एक्सहेल करते समय हम अपने सांस को पूरी बाहर करते हुए अपनी नी को अपने नीज के बगल में नोज को बीच में लाएंगे और अपने आप को बैलेंस करेंगे, काउंट करेंगे 5 तक और हम इस तरह से अपने को छोड़ेंगे। ये कुछ आसन थे। इसके बाद मैं आपको एक राउंड सूर्य नमस्कार करके बताऊंगी जो कि आपके लिए बहुत ही इम्पोर्टेंट है। सूर्य नमस्कार के अनलिमिटेड बेनिफिट्स हैं। सूर्य सन हम सालों से शुरू से एंशिएंट टाइम से
हेलो
सन एज गॉड। तो सिर्फ ये वर्शिप की बात नहीं है, सन के बहुत सारे बेनिफिट्स भी हैं। हमारी दिन की शुरुआत होती है मॉर्निंग सन से, सनलाइट से। ये हमें एनर्जी देता है। इसके अलावा भी सन सैल्यूटेशन के बहुत सारे हैं। बताते हैं कि अगर सन सैल्यूटेशन को सनराइज के डायरेक्शन में आप खुले में करते हैं तो आपके बॉडी में विटामिन डी की जो ऑप्टिमल लेवल होती है वो बैलेंस रहती है। और आपके लिए ये एक जानने की बात है कि आज के डेट में 70% इंडियन पॉपुलेशन इज डेफिशिएंट ऑफ विटामिन डी। तो उसके अलावा सन सैल्यूटेशन या सूर्य नमस्कार से आपका ब्लड सर्कुलेशन बढ़ता है, आपका डाइजेस्टिव सिस्टम बहुत अच्छा रहता है। इट बूस्ट योर डाइजेस्टिव सिस्टम, इट इंक्रीजेस द ब्लड सर्कुलेशन इन योर बॉडी। बहुत सारे एडवांटेजेस है। इट मेक्स योर जॉइंट्स एंड मसल्स स्ट्रॉन्ग। आपका लोअर बॉडी बहुत स्ट्रॉन्ग होता है, आपकी स्किन पर ग्लो आती है, आपके हेयर में बहुत सारा लशियस हेयर। बहुत सारे एडवांटेजेस है सूर्य नमस्कार के। इट लोअर्स योर ब्लड प्रेशर, इट मेंटेन्स योर हार्ट बीट। तो इसके लिए सूर्य नमस्कार हार्ट पेशेंट के लिए भी बहुत अच्छा है। तो इसको मैं प्रैक्टिस करके आपको बताऊंगी। सन सैल्यूटेशन 12 आसनास का एक कॉम्बिनेशन है। तो अगर आप अपने सन सैल्यूटेशन को हर दिन अपने रूटीन लाइफ में इंक्लूड करके 12 टाइम्स सन सैल्यूटेशन करते हैं तो आप हर दिन 144 12 आसनास इनटू 12 राउंड 144 आसन करते हैं जो आपके हेल्थ को बहुत अच्छा करती है। और इसके अलावा इसका जो सबसे इम्पोर्टेंट बेनिफिट है, यह एक नेचुरल वेट लॉस एक्टिविटी है। यह आपकी बॉडी को डिटॉक्स करता है। तो इसके लिए हम प्रैक्टिस करते हैं। 12 आसन होते हैं। आप इसे ध्यान से देखेंगे और प्रैक्टिस करेंगे, आपके लिए बहुत ही अच्छा होगा। सबसे पहले प्रणाम आसन। प्रणाम आसन के लिए हम अपने दोनों पैर को नॉर्मल पोस्चर में खड़े करके पोजीशन में रख के अपने हाथों को जोड़ते हुए ऐसे करके खड़े होंगे। दिस इज कॉल्ड प्रणाम आसन। प्रणाम आसन के बाद हम अपने हाथ को हस्त उत्तान आसन में ले जाएंगे। उठाते हुए हम हस्त उत्तान आसन में अपने हाथों को ले जाएंगे। उसके बाद पद हस्तासन, आगे से झुकते जाएंगे। इसमें ब्रीदिंग की प्रॉब्लम है, जैसे मैंने आपको शुरू में ही बताया है कि जब हम अपने हाथ को ऊपर ले जाते हैं इनहेल करेंगे और नीचे की तरफ जाते हुए एक्सहेल करेंगे। पूरे झुकते हुए हम अपने हाथों को जमीन पर रखेंगे और अपने नोज को अपने नी के पास लाएंगे। उसके बाद हम अश्व संचालन आसन करेंगे। इसके लिए सबसे पहले बाएं पैर को सामने लाते हुए अपने दाहिने पैर को पीछे की तरफ ले जाएंगे। हमारा एंकल और नी एक स्ट्रेट लाइन में होगा, हम सामने की तरफ देखेंगे। चेहरे पर स्माइल रखें। अश्व संचालन आसन के बाद है चौथा आसन है दंड आसन। अपने दाएं लेफ्ट लेग को आप पीछे की तरफ ले जाएं और अपने बॉडी को बैलेंस करें। दिस इज कॉल्ड दंड आसन। दंड आसन के बाद अष्टांग आसन है। अष्टांग आसन के लिए हम अपने बॉडी के 8 पार्ट्स को अर्थ में अपने मैट पर रखेंगे। तो हमारे फीट लगे हुए हैं, नी को लगाएंगे, एल्बो को लगाएंगे, चेस्ट को लगाएंगे और अपने चिन को लगाएंगे और ऊपर की तरफ देखेंगे, स्माइल बनाए रखें। अष्टांगासन के बाद है भुजंगासन। भुजंगासन के लिए अपने बॉडी को स्लाइड करें और अपने वेस्ट से ऊंचा करें, ऊपर की तरफ देखें। उसके बाद आता है पर्वतासन। पर्वतासन के लिए अपने पैरों को, फीट को जमीन पर फ्लैट रखें और अपने नेक को नीचे की तरफ करें। एक्सहेल करें। उसके बाद फिर से अश्व संचालन आसन। इस बार हम अपने राइट लेग को आगे की तरफ लाएंगे। नी और एंकल एक स्ट्रेट लाइन में। अगर आपसे पीछे नी नहीं हो पाती है तो आप नी को सटा भी सकते हैं। सामने की तरफ देखिए, स्माइल बनाते रहें। अश्व संचालन आसन के बाद अपने लेफ्ट लेग को सामने की तरफ लाएं और बदहस्तासन की तरफ अपने नोज को अपने नी में टच करने की कोशिश करें। उसके बाद हस्त उत्तान आसन। ऊपर उठते हुए अपने हाथों को फिर से सटाएं और अंत में प्रणाम आसन। ये सूर्य नमस्कार का एक राउंड है। आप ऐसे 12 राउंड करने की कोशिश कीजिए। ये आपके लिए बहुत ही बेनिफिशियल है। आसन करने के बाद अब धीरे धीरे बॉडी को रिलैक्स करना है, काम करना है और अपने को छोड़ना है। तो उसके बाद हम बैठेंगे कुछ प्राणायाम करने के लिए। सबसे पहले प्राणायाम करने के लिए जरूरी है हमें एक कंफर्टेबल पोजीशन में बैठने के लिए। सुखासन में भी आप बैठ सकते हैं, कोई इशू नहीं है। और उसके बाद हमें ब्रीदिंग प्रैक्टिस करना है। हालांकि बहुत सारी ब्रीदिंग प्रैक्टिसेस होती हैं, पर हार्ट पेशेंट के लिए अनुलोम विलोम, भ्रामरी और ओमकार सबसे बेहतर माना जाता है। अनुलोम विलोम करने के लिए हम अपने दाहिने हाथ के 2 फिंगर को फोल्ड करेंगे अंदर की तरफ, थंब और रिंग फिंगर का यूज करेंगे। तो सबसे पहले हम अपने राइट नॉस्ट्रिल को थंब से प्रेस करेंगे और लेफ्ट नॉस्ट्रिल से सांस लेंगे, क्योंकि अनुलोम विलोम को अल्टरनेट नॉस्ट्रिल ब्रीदिंग भी बोलते हैं। तो सबसे पहले लेफ्ट नॉस्ट्रिल से इनहेल करेंगे, फिर उसको बंद करते हुए रिंग फिंगर से थंब को हटाते हुए राइट नॉस्ट्रिल से एक्सहेल करेंगे। उसी तरह फिर हम राइट नॉस्ट्रिल से इनहेल करते हुए लेफ्ट नॉस्ट्रिल से एक्सहेल करेंगे। ये प्रोसेस हमें मिनिमम 30 टाइम्स करना चाहिए। अनुलोम विलोम के बाद है भ्रामरी प्राणायाम।
Mr. Prakash, we are slowly running out of time. Can we just wind up immediately?
Just 2 minutes.
Okay. Yeah. Okay.
उसके बाद भस्त्रिका प्राणायाम के लिए हम अपने दोनों हाथों के थंब से अपने ईयर्स को क्लोज करके अपनी दोनों इंडेक्स फिंगर को अपने नोज के साइड में रख करके अपने मिडिल फिंगर को फोरहेड पर रखते हुए हम अपने आंख को बंद करके एक हमिंग बी का साउंड निकालेंगे। इसके बाद एक लास्ट है ओमकार। ओमकार बहुत इंपॉर्टेंट होता है और ये आपके बॉडी को रिलैक्स करता है, आपके माइंड को काम करता है और इसके बहुत सारे इफेक्ट होते हैं। तो ओमकार करने के लिए ओमकार 3 सब शब्दों से बना होता है, ओ अ म। ओ ओ के साउंड को हमें 50% टाइम देना चाहिए, को 40% और रेस्ट 10% इन ओम। आई विल जस्ट शो यू वंस। सो अपने हाथों को चिन्ह मुद्रा में रखते हुए अपने थाई पर रखें और आंख को बंद करके अपने फोकस को अपने दोनों आईज के बीच में लाते हुए ओमकार का शब्द करेंगे, ध्वनि निकालेंगे। प्राणायाम करने के बाद एक लास्ट जो प्रोसेस है, हमें अपने हाथों को रब करनी चाहिए। इसे 20 to 30 टाइम आप रब करेंगे तो आपके हाथ में एक एनर्जी डेवलप होगी। उसे अपने आईज पर रखते हुए आप कप योर आईज बट डोंट ब्लिंक योर आईज। आप अपने हाथों को धीरे से जब खोलेंगे तो आप बहुत ही रिलैक्स फील करेंगे। लास्ट में अपने योगा के आसन के बाद समय की कमी है, हमें अपने आसन में शवासन को जरूर प्रैक्टिस करना चाहिए। उसके लिए आप रिलैक्स होकर के लेट जाए शवासन में और अपने को 4 to 5 मिनट शवासन में छोड़े, क्योंकि शवासन प्रोवाइड्स यू टू योर बॉडी एंड योर माइंड टू एब्जॉर्ब मैक्सिमम बेनिफिट ऑफ योगा सेशन। सो आज के लिए धन्यवाद एंड समय कमी के कारण हम इसको लंबा सेशन नहीं दे पाए। थैंक यू सो मच।
Thank you, Divya. I think we'll come back to you again with a deeper session on heart. I think there's a wonderful session which is easily implementable. We are extremely glad to have you on this particular session. We'll see more of you in the future too. Thank you very much. Thank you.
Thank you so much.
I just would like to remind our viewers that we are live streamed on YouTube and Facebook. We now have the first quiz. The first quiz is, which of the following statements are correct regarding yoga for heart health? A, yoga helps regulate blood glucose, blood pressure, and blood cholesterol levels. It further reduces the risk of heart disease. B, yoga serves as a useful tool for quitting smoking. C, the calming effect of yoga has a positive effect on heart health. And D, all the above. The answers will be given at the end of this show, and those who answer correctly will get a wonderful certificate at the end. Thank you. We now have the session intro video. We move on to the next session, which is Your Health Counter. Your Health Counter is a highly popular capsule. It is an initiative of Health4All to connect with India's top medical, nutrition, wellness, and public experts, policymakers to do a straight talk on the latest topics to get insight on disease prevention and health issues. In today's Your Health Counter, we have eminent Dr. Purushottam Lal, a pioneer in interventional cardiology. He has the unique distinction of introducing the largest number of procedures in the field of interventional cardiology for the first time in India, such as rotablator stenting, balloon, mitral valve, valvuloplasty, heart hole closer, TAVI, etc. He has been listed many times in Limca Book of World Records. He has been named as the father of interventional cardiology in India by Professor Adnan Kastre from Germany, a reputed cardiologist in the world. He was awarded Padma Vibhushan, and Dr. B.C. Roy National Award by the President of India, making him the most decorated cardiologist of the country. Welcome, Dr. Lal. But speaking to him is Dr. Swadeep Srivastava, the founder of Heal Foundation and Heal Health, and one of India's top health communication expert. He has been at the forefront of healthcare awareness through healthcare communication and has been instrumental in creating campaigns and platforms for healthcare improvements in India for the last 2 decades. Over to you, Dr. Swadeep.
Good morning, Dr. Lal. Welcome, sir. Yeah. So hope okay, sir. So hope our voice is clear, sir. We can start the discussion.
Yes, we can.
Okay, sir. So we people like me in healthcare don't need introduction about you, and people in not only in Noida in North India but across the country and across the globe have seen a lot of pioneering work done by you, and the way you have been treating and working with your patients, particularly your motto of serving the middle and lower middle class in the country, is been phenomenal and such highly appreciated and decorated also by many awards and accolades which you have earned in your career of more than 3 decades, sir. I personally have been following you for the last almost 3 decades now, from your journey from coming back from US, having a very, very successful practice in US, then coming back to India in Chennai, Apollo Hospital, then Apollo Hospital, Delhi, because you wanted to serve your country. That's why I remember you came back to your you selected a place like Noida to build up one of the first dedicated heart care hospital, which then progressed into becoming a chain of multi-specialty hospital. And Metro is today the name to reckon with in the particularly in the certain segment of the society which comprises of a majority of our population, and they need heart care the most. So you have also been instrumental in bringing that access of to the people, heart care to the people of India, sir. And so what I would like to definitely know from you is, and we thought that this would be the apt topic, wherein with COVID, we have all seen the loom of COVID for the last 2 years now, and it has got a certain impact on the overall healthcare scenario also. Our healthcare infrastructure have been tested. I remember your hospital in Noida, in Delhi, and in about 10 hospitals, what you have, they have also been tested with respect to providing exemplary COVID care in COVID times. And what have been affected is also been the heart care. So this time we thought the topic should be, we should focus on the heart care aspect, which has been impacted, the rising incidence of heart attacks we see in the younger population. And so a lot of things which we'll be discussing over a period of time in this session, sir. Today in this episode, we have eminent cardiologists following after your session. But what most we thought was that if we can also learn from you the journey of development of interventional cardiology, because I remember 3 decades back when you used to work with Dr. Pratap C. Reddy, and Dr. Reddy always used to say that why he started Apollo Hospital, because he got patients and he was not able to provide them treatment. And for bypass surgery, for interventional cardiology, patients were forced to go to foreign countries like UK and US, where the healthcare facilities are more developed. And that's why the intervention cardiology, the first the bypass surgery, then the interventional cardiology advent in India, and its progression, who knows better than you? You have been at the helm of it since day one, and a lot of pioneering things what you have introduced, which have revolutionized heart care in India. And I am personally so gung-ho and passionate about your angiography from the wrist, because that is again which brought a revolution when you said that this is a metro heart screening. You walk in and you just walk out in half an hour, in 1 hour, by having a quick angiography, which is a gold standard for heart screening and detecting heart diseases. So with this, we'll start your PPT, sir, for say about 10 to 15 minutes. Then I'll have some questions from our viewers from across the world, which would like to pose to you, sir. So over to you, Dr. Labs.
Thank you, Dr. Srivastava. You have been very kind, and I can talk a lot about your contributions in the field of journalism. And I think when I got full time in India, you were the first one I started interacting, and that was in '97. And it has been a very pleasure to continue talking to you. And I found you always very genius and top of everything. And that's precisely you are doing now, by educating the people, making them aware, sharing the knowledge with each other. My field is interventional cardiology, and strictly I deal only with the wires, catheter, so forth. And I will go very quickly because it's a highly technical, and so I'll just take 10, 15 minutes. If we go back 90 years back, this was the gentleman in Germany who did the self-catheterization, and that's how the catheterization started. 75 years back, a lot of animal studies were done and how a catheter can be developed. And these are the great people, Dr. Gnutz, Jurgen, Sons.
So your slide is not moving on the screen. Is somebody moving it?
Oh, well, sir, it's moving now?
No, you have to share again, come back again. You just stop share screening and then share again. Stop screening and share. Share again.
Yeah. It's not showing?
It's come now. Now I start moving, yeah? Go to the next.
Is it okay now?
Yeah, now it's okay, sir. Can we go to the next slide? Yes,
So Dr. Gnutz in 77, he did the first angioplasty, and this was the balloon angioplasty. I'm moving fast. Dr. Machanda here in AIMS did the first coronary angioplasty in the country in '84. The right coronary artery on the left, you see the block, and then the balloon, and then after the Dr. Sleep, are you seeing now? Okay.
It is not moving. My other colleagues are seeing the movement. Shankar sir, is it moving on the screen?
No, Sudeep, it's not moving.
Oh, Pavitra, is there an issue with the moving slide? Because all the presentations come and move.
सर कुछ चेंज करना पड़ेगा।
क्या चेंज करना पड़ेगा प्लीज?
सर उनकी पीपीटी से ही कुछ हो रहा है, यहाँ से कुछ नहीं है।
ओके सर. Sir, can anybody stop again and start sharing again?
Sure.
Please एक बार try कर ली.
तो दिख रहा हूँ दोबारा. Read it now, showing?
Yeah, it is showing. It is showing. Now it is showing.
Yeah,
It's
now
now
it's okay. Yeah.
It's moving now.
Yeah.
Next slide. Can you see, Sudeep?
Yes, sir. Yes, sir. It's moving, sir. We can continue without.
All right. Well, since it's quite long, I have to go fast, so I won't go back. Now, see, in the balloon angioplasty, the main was that if the artery is 100% blocked, how to deal with that? And that was the device which we started in '89. And I was involved with Professor Carlton Beck, and we developed the prototype and then did the many cases just to show how it works. It's a slow rotation, like a battery. If you see the rotation, Dr. Sudeep, you are seeing the rotation?
Yeah. Excellent, sir. It is coming a very good view, sir.
All right. Now, after that, we found that it's not really cost effective, and we moved to the new devices came where we will take the fat out of the artery. Let's say there is a block, and it will cut and take the fat. This was the cutter. There's a real cutter which we put inside the artery, and this is inside the artery. What you are seeing is inside the artery. But it did not reduce the reoccurrence. This was the problem with the balloon. Balloon angioplasty, we had a problem of crossing the total occlusions, number one. Two, was the reoccurrence. And this cutting device came to prevent the reoccurrence, but it really didn't. Although it's supported to do with the many complex cases. And these are the first papers on this particular device in our country. Now, rotablator is here to stay. We use in our labs almost daily basis. This is the problem with our folks, is the highly calcified arteries. In India, we get small arteries, diffuse disease. On the top of that, it's highly calcified, where even bypass becomes difficult, but angioplasty, the stent doesn't move, and that's rotablator. It cuts the calcium, and this was the gentleman who helped us to bring the rotablator to the country, and again, it really didn't stop the restenosis, but we were able to do the angioplasty with the help of stent. Now you see, this thing is moving, and there are two arteries, and one is main, and you find the main is totally cut off. Totally cut off from the other two arteries, the multiple blocks, and this is full of calcium. Nobody can really think of doing the angioplasty without cutting with the rotablator. I mean, it's not difficult. It is impossible, to do angioplasty, and that's where the rotablator. And if you will see, that's how this cuts inside the artery. The black shadow around is the calcium. And that's how slowly we did. And this is just to show one example. See, it's the same artery. You were seeing the critical blocks, and now you see almost normal. And we saved the 81, 82-year-old patient from bypass. So that's really much, every day I get the patient who has been advised bypass, where the bypass is the only option. Either patient is too old, or due to many other concomitant medical problems, where the bypass is not possible, or the patient doesn't want, or the patient is very young. And that's where I can say that we can save almost 99% of the patient from the bypass. Now this is the before you see, and this is after. Now, moving, this was, on the first abrasion paper, rotablator paper, and then we came up with the stenting, coronary stenting. The first case we performed was in July 91, and that's animatic model to show how the stent fits in the artery. Now, that's the real first artery, I would say, with the stent in Asia, if I will not say in India. And there was a block. It's a patient came from Maldives. In the beginning, we used to put the stent only to prevent the acute abrupt closure after balloon angioplasty, what we used to call bailout situation. On the left upper, you see the block, and then we did the balloon angioplasty, and on the right up, you see the totally occluded. And that's where we put the stent, and after putting the stent, that's how we started. This was of the first case of the country. And if you see on the left side, lower side, where you see the arrow, so this is the stent inside the artery, which we were very excited. This was first patient, and this patient still comes to me, after a period of, now you can see, 50 years, and after 30 years, he comes, and he happened to be father-in-law of the current president of Maldives, and these are various publications on the stent, and when I see the publication, we have a lot of publication on each, but this is the first publication in the country, first presentation in the country in Indian Heart Journal, which is our main thing. And then comes, like gold stent. And see, in 92, when I was giving the lecture in Delhi, I made a statement, stenting is worse than the disease. That time we were not sure the stent will be a revolutionary treatment. And after 10 years, everything got changed. The technique got changed. And now without stent, we cannot move. Now this is the before, this is after, before, after. And that's the, we can put stent anywhere. That's the neck artery, to prevent the stroke. And this is the aorta. See how bent that aorta is on left side, and you see acute bend. This is right in the abdomen. And after putting the stent on the right side, you see it. And then we did the first case of abdominal aneurysm. On left side is aneurysm, and after putting the stent, it is the thing. And then thereafter we moved to mitral valvuloplasty. Sudeep, are you watching? You're able to see now slides? Sudeep?
Yes, sir. Yes, sir. Very well, sir. Showing, sir. Yeah.
Oh, all right. This is the balloon valvuloplasty. We put Inu balloon. Now, this is the best balloon in the world, and no other balloon could replace. And that I was able to bring to the country in 1990. I was the first investigator, and till today we use it even in the calcified valve to open it. And this was the letter which the Japanese gave. The cost was $3,000, but really I struggled to bring it 1,000 for third world countries like India. And these are the publications of rotablator. And then we started doing the procedure with the help of ECO, and this was our first patient where the patient was not able to afford the cath lab and so forth. And that's where we did. And now moving pulmonary valvuloplasty, this is just to give an idea. I'll skip over there because it's going wrong. Aortic. Now that's very important. Aortic valvuloplasty. That this was the one which we made a prototype artificial heart disease in 91. And these are all, I think, collected the things from various places and then made the device, did the first case in 90. And this is how you can see the videos that time looked like. Is the catheter inside the heart very big, and that's how we open the aortic, and that's new device came, and what we call ampula, and these days we call ECMO. ECMO, we started the prototype. Initially we did supported angioplasty, and now we are using it, and same way ampula. So these are the support system. And there's the holes in the heart. PDA is the one that we started. And this is how the device looked like. And this was 12-year-old boy from Maldives, again in 90, which we did with modified technique. And now skipping further, there are many new devices we did in this. Now this device was this was the big thing. the closing hole in the young girl's heart hole. And this was my dream. A long story how it started, which I will not say. But this was monodisk. I was involved in the clinical development of this device on 19-year-old boy. These are the animal studies. And this we did about 35 cases. And thereafter, better devices came. That's how we closed the VSD. Very challenging. And we started closing the VSD in a boy, 15-year-old, which was rejected for surgery, opened the valve as well as did the, so moving TAVI. TAVI, as you know, is costing so high. And when we started, the company who invented this was France, and I had an agreement with them that the cost will not be more than 3-4 lakh in India. However, later on they sold to Medtronic, and apparently the price went high, and now it is costing 15 lakh or more. I would say 15 to 20 lakh. Now this was the TAVI which we started in 92 when I was given this oration by the Cardiology Society of India. And this was the animated animal studies which we did in Anderson, how they replaced the valve. And thereafter, it was not that successful, and slowly progress carry on. That was the time people laughed that how it can work. But the first catheter in 2002 was done by Alan Crevier with a different device. And then this fellow, he invented the core valve. This is how the core valve goes. And the all animal studies, this was the mutual understanding. And the first core valve uh, implanted in human on July 12 at 2004 at Metro Noida. This was big achievement. It made the history. Lot of countries are calling me now also to present the first case. You know how the it became the antique device, and this was the patient where we did. So due to shortage of time, I'll just skip over. It was just a glimpse of this was the when the certificate was given. That is how we did the successful first case. So the core valve which we did was 21 French, and now it is available on 14 French, and we can do the case in 45 minutes of TAVI. And this was another where we don't have to prepare the valve. And me and Dr. Rievert used to work since 89 onward in Germany and did a lot of cases together. And this was the lady where we did a rapid case, both angioplasty as well as valve replacement in 45 minutes. Thank you so much.
Sir, very quickly, sir, it is very informative. We can have an hour-long session separately on this, and we'll definitely have, because there would be. So very quickly, what people would like to know is one is about this. Why don't we start with angiography with wrist, sir? So what is the difference? What is the genesis of it? Now I believe a lot of more other people would also be doing. But I remember 15 years back when you started, I don't know if many people were doing in India. So what is the advantage you saw? What was the genesis? Can you tell something about it, sir?
Well, see, angiography through the wrist or elbow was nothing new. When the angiography started in 50s and then in 60s in the world, they started from the arm itself, but by giving the cut and so forth. And later on, it started through the groin. And then came in India in 97, 98, with the CT angio. A lot of people were going. And that time, we were not that advanced with CT angio, a lot of radiation, so forth. And when the CT angio will tell anything, and then again we have to do the angio. That's how we developed this technique so that we can do in about 3 minutes. And we started with elbow, where the patient doesn't have to take the clothes. He will just walk in the cath lab, and we'll do quickly echo and blood test. And so by doing everything, the patient was able to go home, not home, to work, in half an hour, or certainly I will say give and take less than 1 hour. We have done more than 60,000 cases now. We presented papers, and our first paper was very long in UK. But anyway, it is better, and now it is done everywhere. So nothing new, and the people in the country, in Delhi NCR, and everywhere, it is done very good. Our concept was different. I won't say it was new invention. It was more of a concept where we took the fear out of the people. The phobia of coronary angiography. People never wanted to hear the word coronary angiography. It was just like an operation, and so we gave the name metro coronary screening, MCS, and then a lot of people started coming, and later on they found it was really because there were a lot of modification. We followed physics formula that with 5 cc dye we used to do the angiography, and still we do it, and with that no physiological changes, and a person can just go back.
So quickly, two more questions because our other cardiologist panelists have also come in. We have a very long 1 hour 15-minute session after this. A lot of heart health related and COVID and heart health and young people dying of heart attack. All these questions will be answered, sir. But my question to you would be like this CT. Now this another new thing came up and was a lot of craze about it. CT angio. Then people started comparing it with angiography and how it can replace it. So, what is your view of on that, sir?
Well, I think CT angio is a very, very good, and these are supplementary. It's not really, I would say, alternate. No, I will order CT angio if a 30-year-old comes to me, and where I'm reasonably convinced that most likely, even though there are risk factors, having coronary artery disease, the chances are very less. And that's the place where we order the CT angio. CT angio, in our practice, I will be ordering CT angio 3-4, I would say, every week. And then the angio, the advantage, the kind of in our institute where we deal with the low middle class people, sometimes they don't want to have two tests. First CT angio, and once I am convinced that there is a likelihood of the disease there, I would rather go, where what we call MCS, through the wrist or elbow, and that also takes, as I said, 3, 4, 5 minutes.
Yeah. Okay. So one last question to you, sir, is I being in healthcare, I have almost been getting got calls from few hundreds of patients for heart treatment and for second opinion, and so one of the commonest thing what I've seen is particularly in the multi-vessel heart disease where more than about 3 or more than 3 vessels are involved with a blockage in the heart, sir. So there's always, I've seen a conflict of opinion. A patient goes to a cardiac surgeon and cardiac surgeon says that I'll do the bypass surgery and it has become advanced and that is the only way to sort out. And there are certain cases where interventional cardiologists have seen that such can be handled with the proper professional angioplasty procedure also. So what is the difference of where patients should know in multi artery diseases that angioplasty is good or of course is the call of the medical practitioner, but what patient should know about the benefit of bypass surgery over angioplasty and benefits of angioplasty over bypass surgeries?
Well, I will answer as short as possible. But Sadeep, I found you many times. You are not less than a cardiologist. You know all about this. And see, and likewise, a lot of people now, they are quite aware of, of the procedures. Those days are gone where the people didn't have knowledge. Now everybody checks with the internet and taking second opinion, third, which is always very good. But now my point is that we divide the treatment in four. If I see one angio where I feel that it is the best for the patient to have an angioplasty, now this is the angioplasty. And there is a one group of patient which I would say the bypass is preferred. And then come the mixture. There we see the pros and cons, and fourth, of course, the medical treatment. Now, if I have a young patient and all the three arteries are blocked, and when I say young, say 40-year-old, 45, 50-year-old, you know, I would prefer personally multiple vessel angioplasty. And if I have a patient at the age of 70, 68, I would prefer bypass because that's the best time for the patient to tolerate the surgery rather than doing the angioplasty and maybe sometime when they become 78 80 the surgery becomes relatively difficult, so we go by each patient. And then at the same time, if I have patient coming from say my village or any village where we find that patient will not be able to come for follow-up and so forth, and we want a very, very long-term result. Bypass is always better for the long-term result. The people coming from the villages sometimes cannot afford because these days the angioplasty, when we do the multiple vessels by using road ablators and so forth, becomes more expensive than the bypass.
Right, sir. So what would be your message for this new year? Any health resolution, particularly related to heart health, when a lot of incidences of heart health in youth are also growing up? So what would be the message people should take care for coming from you, sir, in this new year?
Well, I tell you, for any heart health, I would say the ideal weight, by burning calories or eating and burning calories and exercise program, diet program. So these are the, a major thing to avoid smoking. And if somebody drinks, they should limit to moderate drinking, and diabetes, hypertension should be controlled. Of course, we have to deal with the stress where the role of yoga comes, and these are and then of course you will be talking on different places, how to be, take the precautions from COVID.
Right, so please continue.
Yeah. So these are the things a person has to care. And in totality, I would say that general checkups are very good, and the people who are heart patient, they have to be very careful, particularly in winter, and then they have to be more careful in this COVID scenario, but unfortunately, whole world is facing, where the chances of getting cardiac events are getting more and more. I would say that probably the increased viscosity and many other inflammatory changes. So just do the exercise, eat good, eat healthy diet, and I think that will keep the people in a fit condition.
Thank you. Thank you, sir. This was wonderful, sir. We'll keep continue with you in our other series, sir. And thank you for coming and sparing time, sir. We got a lot of information. Our people, definitely our viewers are going to benefit out of it.
All right.
Thank
You
you.
so
Have a
much.
nice day.
Very kind of.
Thank you. Over to you, Shankar, sir. Shankar, sir, unmute, please.
Thank you, Sudeep. I think it was a wonderful session with Dr. Purushottam Lal. Quite a lot of information. Only regret is that we had to end it so soon. There are a lot of questions, I presume, that could have been asked, but we'll have Dr. Lal again in another session. We now have the montage and show intro video. Welcome back. This is we move on to session 2. Before we move on to this session, let me remind our viewers that we are live streamed on YouTube and Facebook. Session 2 is the heart of this particular episode, and the topic is COVID and its effects on cardiovascular health, preventive strategies. We have with us a huge panel, expert panel. We have with us Dr. Mohit D. Gupta, who is currently working as Professor of Cardiology in GB Pant Hospital. He was honored with Excellence in Cardiology in 2018, award by Minister of Health and Family Welfare. He has excellent research in genetics. He was awarded the Bishan Swarup Young Scientist Award of the Year in 2018 by the Vice President of India. Joining him is Dr. H.S. Bedi, currently the Director, Cardiovascular and Thoracic Sciences, EV Hospital, Mohali, Punjab. He earlier worked at the St. Vincent's Hospital in Sydney and the original Escort Hospital Institute in New Delhi. Also, we have Professor Shekhar Kashyap, the former head of Department of Cardiology at Research and Referral Hospital, New Delhi, and an alumnus of the Armed Forces Medical College, Pune, and All India Institute of Medical Sciences, New Delhi. His current passion, apart from preventive, clinical, and interventional cardiology, is to help propagate easily implementable evidence-based therapeutic and behavioral interventions at individual, household, and community levels. These include tobacco, alcohol, and nutrition-related lifestyle modifications at the intersection of prevention of cardiovascular disease, diabetes, cancer, and their role in preventing COVID-19 during the ongoing pandemic. We also have with us Ms. Jigna Seth, who has 25 years experience in diabetics, nutrition, fitness, health, and wellness industry. Previously, she has worked with Nanavati Hospital, Hinduja Hospital. She also served as the General Manager of Diabetic and Nutrition at Talwarkar's Gymnasium. Joining her is Dr. Mohammad Sadiq Azam, who is currently the consultant cardiologist at KIMS Hospital in Hyderabad. And last but not the least, we have Dr. Satyendra Goyal, the founder and CEO of India Health Link, a world's first consumer-centric health and wellness platform. He has spent 15 years in healthcare ecosystem in various roles, including Chief Science Officer at Colibra and a data intelligence company, medical school faculty at Northwestern University, and as an advisor to several healthcare companies. He has filed more than 10 patents and is a serial entrepreneur with the latest exit in a patient and privacy technology startup. So we'll start out with the show. I'm sorry that we're running late, but then we'll try to make up. My first question, of course, is Professor Mohit Gupta. Dr. Gupta, during COVID, especially the Delta phase, lung function was seriously compromised in severe infective cases. This affected oxygenation and in return, functioning of the heart. Should patients who have recovered from COVID get a regular periodic heart evaluation test done? You can speak on patients with and without comorbidities who are down with COVID infection. Dr. Gupta.
Thank you so much. Thank you for this opportunity. Very good morning to all of you. And a very pertinent question. The big question is that once it is biting the heart, is it also licking the lung also? Now, this thing is answered in a very simple way. Recently, what we did was we conducted a study in patients who are COVID recovered. Now, those patients who are actually COVID recovered, these patients, we started analyzing and seeing whether their heart is actually affected when they had a normal echo function. And to our surprise, what we saw was, this was documented in the Journal of Echocardiography very recently, that those patients who are apparently absolutely healthy with a normal ejection fraction, the subclinical dysfunction in the heart had already started occurring. Now, this is something which is revealing what a person thinks that he's COVID recovered. This person is already having an effect on the heart when there's absolutely the equation normal. This we analyzed on the basis of speckle tracking and a special kind of imaging, which is called strain rate imaging. And we are following up these patients. More severe was the COVID illness, the more chances was there that the heart would be affected. So definitely, while it is affecting the lung, it is also affecting the heart simultaneously depending on the severity of the COVID. Now, we have two perspectives on this. We must understand that whenever COVID is affecting our lungs, heart is simultaneously affected in almost ranging from 6% to 50 to 60% of the cases. The various manifestations of COVID on heart could range from an acute heart attack to a heart failure to heart blocks to venous thromboembolisms, that means there's more chances of clotting, to myocarditis, that means there is a dilatation of the heart muscles, and this also is manifesting in what we call as a long haul COVID or the post COVID syndrome, in which these patients are having effect on the heart muscle also and also on the rhythm of the heart. So this is very pertinent that every COVID patient who is either recovered or is in the active phase of that particular disease must have a baseline cardiac checkup. It is mandatory. And this becomes even more important, especially when a patient is symptomatic. Interestingly, one good news is that those patients who are having an effect on the heart, the recovery that is happening on follow-up of these COVID patients is much better. So definitely heart or cardiologist's role is significant in any illness of COVID. And there are various pathophysiological mechanisms that are happening because of the direct damage, because of the indirect damage, because of the immune response that is being generated. But heart is definitely affected both in the acute illness as well as during the recovery phase, as well as in those patients who are apparently absolutely healthy. These patients still have some level of chances of having an effect on the heart.
Now, you spoke of long COVID. Now, how often should patients come for a heart evaluation, especially if they are in the 30 to 50 age group? Do you suggest any period from which they should come for both symptomatic and asymptomatic patients who had COVID?
All the patients, I strongly suggest that there's in the studies that have been recently documented and in our own data, 15 to 30% of the patients are affected by what we call as the post-COVID-19 syndrome. This can manifest in 5 ways. One is chest pain. Second is simple breathlessness. The third one is some level of palpitations and dizziness, what we call as syncope and pre-syncope. All these patients who are having these kind of symptoms are and must immediately go and visit the doctor, because these are the patients who are having more chances of having an effect on the heart. But I suggest that all the patients, even if they are recovered, they must have a direct evaluation of the heart. And third thing is, all the patients who have suffered from moderate to severe COVID, 80 to 90% have underlying heart damage. So they should also have a baseline evaluation of the heart. In case the baseline evaluation yields some kind of dysfunction, my suggestion is that they should follow up their doctor every 6 months. But if the baseline evaluation of the heart shows a normal function, then probably a long-term or a routine follow-up of cardiac checkup is not needed in these patients.
Yeah, next question is, COVID scare was a major factor in lesser hospitalization for heart failure and heart attacks. However, available data indicate now that significantly higher mortality due to these ailments than due to COVID. Your comments?
Definitely. There is no doubt about it. Remember, what was happening in the COVID in India particularly was because of the lockdown, many of the seriously ill patients who are manifesting acute heart attack or who are having severe heart failure were unable to reach even their peripheral center. So the data that we actually have for causing the mortality is actually biased and actually not true. There were many patients who were dying because of the collateral damage that was happening. Remember, even today, the deaths because of COVID were significant. It was a high impact, but still the mortalities due to acute heart attack and heart failure were significantly high. Even our own hospital witnessed significant increase in presentations of the acute myocardial infarction. So it is very pertinent that while we are taking care of these illnesses, COVID is acting like and especially in those patients who are having comorbidities like diabetes, like hypertension, like obesity, all these patients are more likely to develop more severe complications like heart failure and also chances of an acute heart attack or acute myocardial infarction. So in case you have any of these symptoms, in case you have any kind of these problems, it is very pertinent to immediately report to the hospital. there is no doubt in the largest registry that we have conducted along with Cardiological Society of India, we have clearly documented the underreporting. Still, the myocardial infarctions and heart failure were significantly high in the COVID times. It was only because of the underreporting that we were not able to get the exact data. It is very important. COVID is a very severe disease. It can create such a level of immune damage, and if the immune response is triggered, it will practically destroy and lead to catastrophic complications both on the heart muscle as well as on the rhythms of the heart.
My next question is, some people infected with coronavirus develop abnormal blood clotting. In some people with COVID-19, there is a massive inflammatory response, the cytokine storm that raises clotting factors in the blood. Doctors have been reporting more blood clots in the lungs, the legs, and elsewhere. Are these blood clots seen in severe cases of COVID-19 unique in some way, and is it reversible?
See, there is no doubt that the immune response, the COVID is working because of the triggering of the immune response. What happens is, like a layman, if you try to understand, that our body has a natural protective mechanism. Now, when this natural protective mechanism is getting active, it is releasing interferons as well as interleukin. Sometimes this response gets overwhelmed, and triggering of this immune response can lead to increase in the vascular permeability. That means your blood vessels start leaking. It can direct have damage on your lungs, which leads to alveolar damage. It can also lead to multi-system involvement, and all these things will lead to formation of what we call as the microthrombi, small thrombi. So what the picture that you were seeing in the lungs, like a ground glass appearance, complete white lung, was actually the microthrombi and endothelial inflammation and disrupted intracellular formation that we are seeing. So microthrombi and these things are a very known phenomenon. Even now, COVID is significantly increasing the blood clotting. So how do we deal with these things? Two ways. If the blood clotting, now see, if the heart is being affected directly because of COVID, that is the time where anticoagulation and all these things will really help us immediately and direct measures. But if it is because of the immune damage that is occurring, which is occurring a week to 2 to 3 weeks later, that is where the steroids and other drugs are also helpful in addition to the anticoagulation. So we must understand, judiciously deciding that what is the possibility, is it directly because of the effect on the heart, immediate, or is it a delayed immune response? We have to balance our strategy. Beyond doubt, anticoagulation remains a forefront in dealing these cases. And today we have documentation that novel oral anticoagulations and low molecular weight heparins are preferred over vitamin K antagonists, and they have to be given prolonged in certain cases. Those who have suffered these kind of clots, probably more than 3 months. So it is very important that anticoagulation plus minus optimal and a very proper use of steroid therapy is going to help these patients recover very well from cardiac affliction.
Thank you, Dr. Gupta. But before I move on to the other speakers, I would just like to have a brief New Year message regarding COVID and the heart, which we can disseminate among the people.
See, my simple message to you is very clear. If we want to protect our heart, we need 3 things to balance our life. I've always strongly believed the pillars of our health are diet, exercise, and rest. Remember these 3 things. Now, diet, not just for the body and also for the mind. Remember, COVID has affected our bodies and hearts significantly, but more so, COVID has destroyed our mind because of fear and the anxiety with which people live in. So that is why my first message to you is have a good, normal diet, immune diet. There's no need to focus. Whatever we are eating every day in our lifestyle, in our daily life is very good. Have green leafy vegetables, good soups, good vegetables, good amount of water. All these things are going to help you, but simultaneously have good diet for your mind. That means give positive thoughts to your mind. It's fear and anxiety that increases the immune response and manifests and has a catastrophic effect on our own personality. The second message that I would like to give you is exercise. You would be surprised that one of the largest studies that was conducted in more than 4 lakh patients, those people who were doing yoga and exercise daily, the chances of their getting hospitalized or having severe hospitalization or even reporting to the hospital were 50% less as compared to those people who were not exercising. That is the importance, because when we are exercising, it increases our blood flow to the brain. The calming hormones like GABA, like dopamine, they are increasing, and we are having a very beautiful and a wonderful relaxing response on our body. Similarly, when you are exercising for the body, you must also exercise your mind to think more and more proactively, more positively. Our social media, print media, and digital media is, rather than doing just help, it is more spreading negative messages, false messages, and people are just contacting us every day that, doctor, this is the new technology. Remember, you must ask that, am I the master or my mobile is my master? You are judicious. So remember that if we are spreading some kind of a false message on a WhatsApp or on a social media, we are spreading fear to millions and millions of people, which is disastrous. And we have very beautifully dealt with these things in our, practically when we are dealing with the COVID patients. So the second message is exercise both for your body as well as for your mind. And my third powerful message for you all is take a proper rest. It's important to sleep properly. But my question to all of you is that when we sleep for 6 to 8 hours, are you also making your mind sleep? Very important. It's important that your mind sleeps. Today, I sleep for 4 hours in a single day, from 11 till 3 a.m. in the morning. That is all. But at that particular time, I ensure that my mind after meditation is also in relaxation. It's comfortable. Morning 3:15, I will get up, do a proper meditation, Raj Yoga meditation. I will take up to my lifestyle. This is what is going to help you. Because when your mind is completely balanced, it's in a harmony with nature and your own self. Remember, these viral illnesses, these heart attacks, all these things significantly decrease. We have studied these things in our patients. I operate almost 200 patients, 300 patients in a single 2 weeks. And 35% of the cases are coming between 20 to 35 years. What is the cause? It's not the diabetes, hypertension, or something else. It's our lifestyle that is destroying our young people and generation, as you were talking with Dr. Lal. So we need to take care of this. That COVID is going to affect only those people, or significantly, when your own immune capacity is significantly weak. So let this new year be a new beginning when you are following a ABCDE approach. A is assess yourself every year. B is measure your blood pressure regularly. Very, very important. Check whether you are a hypertensive or not, or at least once in a year. And if you are a hypertensive, check it regularly. C is check your cholesterol. Check whether you are smoking or not. If you are smoking cigarette, give it away. Have your cholesterol levels in orders. And D is measure your diabetes status. Very, very important. And also take care of your diet. It is very important. Both diet and diabetes are very important. And E is exercise every day. Very important. The E is exercise and take care of your emotions and emotional health. Remember, disease is made of two words, dis plus ease. When easiness goes away from our mind first, then only you become diseased. A person does not become diseased by the body, but only the perception of the disease. When it starts in our mind, we start getting the manifestation of the disease. That is why most of the patients say कि डॉक्टर साहब आपसे बात करके मेरी आधी बीमारी दूर हो जाती है. Why? Because you are able to take away the agony of the patient from the mind. So remember, my dear friends, those who are listening, your health is completely in your hands. Don't get afraid of COVID. Nothing to worry. All these things come. Your protection, masking, all these things are going to help you. But your positive mindset, proactive mindset is what is going to completely make you live a life which is full of abundance, which is full of joy, which is full of peace, happiness, and which is full of amazing level of bliss in your life.
Thank you very much, Dr. Gupta. I think that was quite inspiring and wonderful having you here in this particular session. I'm sure your message will go across to a lot of people on this show and even when we have the future shows. Thank you. It was wonderful having you with us. My next question is to Dr. H.S. Bedi. Dr. Bedi, of all the Indian states, Punjab is supposed to be the heart capital or heart disease capital of India. And Punjabis are more prone to developing heart diseases. Now, that's mainly because of you have lifestyle issues, you have drugs on the other hand, and now you have COVID. So what do you have got to say about this particular scenario with regard to Punjab?
Thank you.
Dr. Shankar, and a very good morning to all my co-panelists and my dear friends, Dr. Lal, if he's still there, and our listeners. Can you hear me, Dr.
Yes,
Shankar?
we can hear you loud and clear. Yes.
Yeah. So you're very right. When I was in the Escorts Heart, this is about 30 years back, we had done a study and we just found out that the incidence of heart disease, as you have pointed out rightly, was actually double in that small study. So it was not a large study. So now when I came finally to Punjab, I practice in Punjab now and tried to study that why is heart disease so common. And of course, lifestyle, eating too much fatty food. See, about 30 years back, my grandfather would eat, lot of ghee, but then he would walk to work, he would exercise, and he had a healthy lifestyle. If I eat that same amount, I'm driving my car to the hospital, working there for 8, 9 hours, coming back and just relaxing in front of the TV. So I hardly do any exercise. And this is true for so many of my people in my state, in my country. So number one is lack of exercise and lifestyle. But now slowly, I have noted that I'm operating on people 30 years of age who are otherwise to look at, they're quite healthy. And then when we've asked them, they say we are so much stressed. So one of the most important reasons for increasing heart disease, especially in youngsters, is stress. They have a good lifestyle, by money wise I mean, and good quality of life, but they are constantly given targets, whatever profession, whether it is medical, it is the software engineers, it is marketing. So that is something we have to look at very carefully. Otherwise, our next generation will probably be the first generation in the history of mankind which has a shorter lifespan than their immediate predecessors. So that is one. And about COVID, I think we have all, whatever our race, religion, we've all been badly affected. As I say in any of my talks, to borrow a famous author, this is the worst of times in probably thousands of years. But also, it is the best of times. Why? Because we have been challenged, and we as medical community have beautifully risen to that challenge, as administrators have risen to the challenge, and to overcome to some extent this problem.
Fine. My next question is a bit technical. Cardiovascular involvement in COVID, is it early or late immunological vasculitis or inflammation of the blood vessels that cause the changes in blood vessel walls? When does actually vascular involvement start?
See, surprisingly, this vascular involvement starts quite early, and by we I mean the medical community, were not really aware of it until some colleagues in Italy did the autopsy and they found that the actual was so thrombi in both the arterial and venous system. So it's a hypercoagulable state. The reasons are varied. There is a damage to the endothelium. There is a down regulation of the ACE2, and which led us initially to think that patients who were on ACE inhibitors might respond differently, but that didn't actually prove. And so it happens quite early. We have had patients with cardiomyopathies. We have had patients with acute heart attacks, not very common, but more than you would have thought in that population which has a viral infection. So definitely it happens early, but also patient may recover fully, but he still will have some sequelae of heart disease. Professor Mohit told us his study. Coincidentally, just yesterday, there is a published study from the Journal of American Heart. Studies from Norway, they studied the patients asymptomatic cardiac-wise who had COVID up to 3 months. So it's obviously not a large study because it's still a young disease. And they found that at 3 months, people who were pre-COVID thought to be normal had heart problems which continued at least up to 3 months, like diastolic and systolic dysfunction. So this is very disturbing that we have to follow these patients further, and we don't know what disease entity, for example, 10 years down the line, what disease entity might happen to these young patients, young and old.
Thank you, Dr. Bedi. We'll come back to you in the second round. Thank you very much for the first round. We have more questions for you. Now I move on to Dr. Professor Kashyap. Dr. Kashyap, my question to you would be, young people who were COVID infected were told not to exert for a period ranging from 3 to 6 months due to the involvement of the lungs and the heart. There were instances of young people unexpectedly dropping dead. You have an armed forces background. How is this issue tackled in the armed forces where physical training is sometimes rigorous?
Very important question, and it has been alluded to both by Dr. First Speaker and Dr. Bedi. First of all, we must understand that COVID-19 illness, just like any other viral illness, it affects all organs. Some are involved more, which express themselves clinically. So you get diagnosed with COVID pneumonia or COVID myocarditis or COVID thromboembolism, but it's a systemic illness. And also, as Dr. First Speaker, Dr. Mohit, pointed out that there could be a low-grade myocarditis resulting in subclinical myocardial dysfunction picked up by specialized tests like echocardiogram. These are the patients who are at risk of exercise-induced or when they go beyond their effort tolerance to develop arrhythmias, which they are vulnerable in any case. So a good marker for that is that if somebody recovers from COVID-19 or any other viral illness and suffers from profound fatigue, the definition of fatigue is feeling of being tired after minimal exertion for which person is used to otherwise. So these are the patients where one should suspect there could be a subclinical myocarditis, which makes them vulnerable to all kinds of problems, including sudden death on exertion. So these are the patients who should be investigated in a targeted manner. And if there are signs and symptoms of myocarditis, they should be given prolonged rest. And there are some medicines also, which I will not go into detail here, but they can be put on some medicines also to make them recover, particularly those who are found to have impaired heart function. Here, because the context has come up, I would like to say that we must investigate and counsel patients in a targeted manner, because one of the hazards in any pandemic, and more so in the current pandemic, is that one should not overwhelm medical and healthcare systems, because positivity rate in some of our metropolitan cities is 25%, going up to 50%. If we were to advise all of them to undergo complete cardiac checkup, complete lung checkup, and other investigations, the medical system and the healthcare system will get overwhelmed. So it should be done in a targeted manner. Those patients who have profound fatigue or sequelae after initial illness should be investigated. All others can follow routine healthful activities like good nutrition, remaining well hydrated, etc.
Well, you are passionate about propagating easily implementable evidence-based therapeutic and behavioral interventions in individuals, households, and community levels with regard to COVID and the heart. Can you elaborate on this? What exactly are you doing?
This is very, very important. In the current pandemic, which has revealed some very interesting substrates for COVID-19, that it is found that almost 2/3 of the patients had components of metabolic syndrome, that either they were obese or overweight, hypertensive, diabetic, or had tendency to high blood sugar. Now, this clustering is called metabolic syndrome. One can have one or all of them. These are the people who were especially vulnerable to acquiring COVID infection. And if they did acquire COVID infection, they were more likely to develop severe illness, complicated illness, going on to ventilator, or even mortality. And this is pure nutrition related thing as it has come out. To give you an example, that in the current wave going on in the United States, there's a pediatric involvement also. And those who are hospitalized or less than 5 years of age with COVID-19 and those who have critical illness, who are these kids? They are overweight, dyslipidemic, those who have component of metabolic syndrome. Now, can one blame a 4-year-old kid for lifestyle problem or a stress problem? Answer is no. The nutrition which has fast food industry promoted, and it has reached third world also, is more on starchy stuff, less on fiber, and the oils and ghees which are utilized are trans fats or inflammation generating nutritional substances. Now, how do these dots get connected? Very simple. Dr. Bedi mentioned that it is a dysregulation of angiotensin converting enzyme 2. ACE2 is the enzyme which acts as a receptor for COVID-19 virus to get into the cells, particularly in the lungs. And this enzyme system called renin-angiotensin system is also the principal enzyme which controls our vascular permeability, vascular stability, and cardiovascular functions. Now, once this angiotensin converting enzyme is dysregulated, COVID gets in faster. Now, all these conditions, whether you are hyperglycemic, that is diabetic or tendency to diabetes, obese, hypertensive, or cardiovascular disease, these all cause dysregulation of angiotensin converting enzyme 2, facilitating entry of COVID-19. Conversely, this enzyme is also impacted by insulin signaling. Each time one consumes sugary beverages or fiberless starchy diet, there's an insulin spike, which acts as an insulin signal, which causes dysregulation of angiotensin converting enzyme 2, which is the receptor. And that is why in African subcontinent, where in the rural Africa, the vaccination rates are very, very low, the prevalence of COVID-19 is also low, and it is now a mainstream. These papers have been published in just last 2 weeks. I'll not bombard my lay audience with the references, but suffice it to say that if you are consuming plant-based diet rich in fiber, your vulnerability to COVID-19 is much lower, not only because of ACE2 dysregulation is prevented, but also they further boost up immune systems. And in this vein, I would also emphasize the state of hydration. One, it sounds like a very common sense advice, which it is, that one should remain well hydrated. But if you are well hydrated, it also prevents dysregulation of angiotensin converting enzyme 2. Because when you are dehydrated, again, angiotensin converting, and because renin-angiotensin system is the principal system which maintains water, electrolyte, and vascular stability homeostasis in our body.
Extremely valid points, Dr. Kashyap. I think it's very unfortunate that what is happening in the West is now slowly percolating to India, where children are now on fast foods and low fiber diet. And this may also
just add a little bit over here. Sorry for interruption.
Yes.
That we often hear that मैं तो भाई बहुत ही healthy diet खाता हूँ, मैं meat नहीं खाता हूँ, ये नहीं करता हूँ. But most urban Indians today are what I would call, they are starchitarians. They consume a lot of starch, whether it is wheat or polished rice or sugar. They consume vegetables, all right, but they've been destroyed by high pressure cooking because all heat labile vitamins and phytonutrients are destroyed. And also the vegetable oils which are refined have undergone such complex processes of refining and removal of the fiber and innate nutrients that they are no longer not only not healthy, they are inflammation generating, and they produce body inflammation, which makes us more vulnerable to all infections, vascular diseases, metabolic diseases, and long term also predisposed to development of cancer.
Extremely valid points. I think we can have a complete session on this particular dietary habits. I think it's just slowly now changing here in India. It was wonderful speaking to you, Dr. Kashyap. Over to you, Sudeep, for the next session.
Thank you.
Yeah, so I'll request all the speakers to remain. We'll have the next round of discussion on these topics. But just breaking the trend from the discussion with the cardiologists and on the heart diseases, we have a technology expert from US, Dr. Satyendra Goyal. Dr. Goyal, welcome. And my quick question to you is on, at one hand, there is an excessive use of mobile and smartphone and digital space also affecting the health poorly. On the other hand, it has been detrimental to good health, in fact, you can say, particularly amongst the youth. On the other hand, we have got the digital technology and technology as a whole also complementing the efforts of doctors and hospitals. Particularly, you have created India Health Link and propagating this in India. So what is your view on it? How digital can be best used for complementing all the efforts of the doctors and hospitals and helping our people live a better, more informed, healthy life? Over to you, Dr. Goyal.
Thanks, Dr. Srivastava, and thanks everyone else to be on this panel with me. So I would say that the theme is very clear. The theme is very clear for where lifestyle and habits actually play a role in all circumstances. The question which I think we should also ask is, are the habits always bad in the terms of, yes, everybody knows drinking in excess is bad, smoking is bad for health, food is sometimes bad, certain types of food is bad. But I think in India, what we are forgetting is that education awareness is missing. So our individuals, where technology can play a role, in our sense, and that's why the India Health Link, we started with a simple mission. Can we educate our people to be able to understand what is bad, what is good? And more importantly, in healthcare, there is no one size fits all. The correlation of these factors, let's say we can say exercise is very good. Somebody can exercise every day, all day, but again, they might not be eating good food. Maybe they have other factors. Maybe they're not even fit for exercising all day, every day, because they're not supposed to. Now, how do we correlate these factors with somebody's health is where the technology can play a role. And technology can play a role by educating people and making them aware of their own self. Own self by simple things like Dr. Mohit was saying, have you done a checkup? Do you know what your blood pressure regularly is? Do you know what your other vital parameters are, or other lab factors like cholesterol? What is your body? How is your body reacting to these things? Based on that, how your lifestyle should be. Those two things actually where technology can play a role. And Dr. Srivastava, you are saying it right, that mobile sometimes is wrong because everybody relates that to a social media use of mobile all the time and the screen usage. But at the same time now, because of telemedicine, because of the phone in most of the people's hand, they have access to those experts, that information that they can gain themselves. The only, again, where we are coming into picture is how can we bring them in a simple, accessible way that everybody can understand that. We are not bringing new information to individuals, but technology can play a role in that particular area, that the guidance of people to correlate what is right at the right time at the right place.
Wonderful. So I know, so you have, thank you for joining us from Chicago. I understand it's almost going to be midnight there, but please stay with us because we have a very interesting presentation by you at the end of the session. Over to you, and of course, please do tell us about one of the breakthrough technologies you have brought to India, that is HPOD. And HPOD and what you call a digital health center or something like a digital clinic, how it is going to help the people here, particularly in cardiovascular health. That is one of the key things which you can cover in your presentation. Very eager, all our viewers and everybody is very eager to listen to that. Over to you, Shankar sir. We have a leading nutritionist, Ms. Jigna Sheth, and of course, our favorite cardiologist from Hyderabad, Dr. Azam. We are waiting to listen to them. And then I have got a few, I would say, tricky questions to all the esteemed cardiologists. Little tricky in a sense, there's some controversies related to cholesterol level. What is the right cholesterol measurement? And of course, the linkage of excessive use of steroids and a lot of antivirals, antibiotics gone up in these times of COVID. So I'd like to listen to from our experts in our second round, what is their view on that. Shankar sir, over to you.
Thank you, Dr. Sudeep. I think wonderful hearing Dr. Ms. Goyal from there, all the way from Canada. My question to Ms. Jigna Sheth is, you earlier worked as the general manager of one of the leading gymnasiums, the Tavarkas. Jim was in the news with the unfortunate death of Sandalwood actor Puneet Rajkumar. So much so that some states are proposing the mandatory presence of cardiologists and wellness experts at gyms. What are the precautions that COVID recovered people should take before hitting the gym?
Thank you for having me on the panel, and good morning to all the panelists. It's such a wonderful session that we've been hearing since morning. Now, the question that you have asked me is regarding the presence of cardiologists and a nutritionist at the gym and the precautions that the patients who have recovered from the corona, what kind of precautions they should take. Is the first and foremost thing that I would advise them is to take approval from their cardiologist or from their doctor. In case first they have to check their blood pressure, sugar, all the other parameters should be under check before they hit the gym. Secondly, if you are hitting a gym, it is very, very important that you're guided by a qualified nutritionist and a fitness trainer. As I said, most of the time, these trainers or dietitians, if they are, especially the trainers, if they are not qualified enough and if they are giving, a lot of time it is seen that they have been giving a lot of diet advice to their patients or to their clients, which should be avoided. And once you have recovered, it is important that you get your heart rate checked, your blood pressure checked, and your diet should be a properly disciplined diet. Once you feel there is no fatigue, you're not getting tired, only then you should think of going back to the gym. Otherwise, I would advocate start with a very, very slow paced exercises.
Now, you're a nutritionist plus also a wellness expert. Now, my simple question to you is, what is better, jogging or walking, or a more intensive exercise that is needed to keep the heart healthy? And of course, or we have yoga also. But on the lighter side, don't please combine all this because we have only 24 hours.
Okay, yeah. So as you said, see, there is nothing like something is better over the other. As Doctor or the one of the eminent panelists said, that one size does not fit all. So all the exercises that we design or we decide to do, it has to be very, very individualized. And when you start with any kind of exercises, we always say start with the slow pace exercises, check your heart rate under control. So there is nothing like a shortcut that tomorrow morning I decide to go for a walk and start with a fast paced jogging. So, and most importantly, we stress on checking your heart rate. So you have to work out in a particular zone of heart rate to get the maximum benefit. So if you're working out for a weight loss, there's a specific heart rate zone that you should work on. Or if you're working for just a fitness or for your endurance. So it depending on what is your goal, it's a weight loss or a maintenance, accordingly your exercises should be designed. And I would insist that get it designed from a professional. Do not start on your own if you're not aware of any kind of a physiology or importance of exercises.
Yeah, Dr. Kashyap had earlier said most vitamins is lost because we steam cook our vegetables and tend to lose all the things. So, what is your advice regarding this?
So, yeah, one of the things that Dr. Kashyap was mentioning that cooking would destroy. So, there are some vitamins which are heat liable, they would get destroyed. So, what we advocate that you include a lot of fruits and along with that vegetables. And vegetables, one most important thing for our Indians is that we tend to overcook it with a lot of oil being added there. So overcooking of any vegetable should be avoided. You can have it in the form of soups or even sorted vegetables, or just do a basic seasoning of your vegetables. Do not overcook any vegetables to retain the nutrition.
Oh, thank you. We will get back to you, Ms. Jigna, I think later on the second round. It was wonderful hearing you.
Thank you having me.
I will, please stay on because we'll have another round of questions with you.
Sure.
We'll move on to Dr. Azam from Hyderabad. Dr. Azam, are you here?
Yeah, I'm here.
Welcome. Glad to see you again. Last time I had questioned you regarding some of the things in Hyderabad. Yes. So
yes.
I have this passion of coming back to Hyderabad. Now,
Yeah,
Dr. Azam,
welcome. I'm glad to be here.
You come from Hyderabad, which has a lot of IT presence. So my question is, should young COVID recovered IT professionals take a periodic heart evaluation test, especially TMT? And if so, how often?
Well, as our first speaker professor was saying, anybody who has recovered from COVID, you need to look at the heart, because it's very rightly said that we are seeing a lot of upsurge of cardiac illness, especially in those who are who have been recovered from this virus. And the more severe the disease, especially those who have been through an inflammatory phase of COVID-19, the chances of having an underlying cardiac issue is also there, whether it's a thrombotic issue or whether it's a myocarditis, or whether it was just they developed myocarditis during the COVID period, or they developed it post-COVID sequelae or the long COVID. Yes, you need to look at the heart. So whether you're an IT professional or not, whether you're young or old, if you've had COVID, I think you should go for a cardiac evaluation. The decision of whether to go for a treadmill or not is it's again not one size fits all. I would really not recommend anyone, young or old, to take the decision of doing a stress test on your own. Meet your doctor, let him assess you, let him look at your functional capacity, and then take a decision whether you need to go for a stress test or not. Because this sometimes, like Sir was rightly saying, there are many patients who have subclinical LV dysfunction, who have subclinical myocarditis, they have some dilatation in their chambers. Putting them through a stress test can precipitate arrhythmias, it can precipitate heart failure, it can precipitate cardiac events. So somebody who has an abnormal ECG or an abnormal echocardiogram, we do not put them through a treadmill unless it's absolutely necessary, and that too not without the presence of a doctor around there, because it's not like, the reason, one of the reasons, as we were just discussing some time back, that people who go to gyms and do strenuous workouts, you've had instances of people dropping dead, people who've had MIs after that. It's not about going to the gym, it's not about working out, it's about pushing your body beyond its limits. I mean, if you see in most of the gyms you go, the first thing that a trainer tells you is listen to your body. Okay, so if your body is telling you something is wrong, stop. It's very often a question of peer pressure. Arey yaar, everybody is working out. मैं रुक गया तो कैसे? So don't do that. See, the end of the day, you got to be alive first, and then comes everything else. And it's not that I'll start going to the gym and lose 5 kgs in a week. No, it's a gradual process. It's something that you might not even see the change every day when you look into the mirror, but you will see results going down the road. So a treadmill or any kind of a stress test. I mean, a couple of some time back, it was in the news that go for a coronary CT coronary angiogram once a year, everybody. And this again another extreme. I feel. I mean, I don't think it's recommended or prudent to say something like that. Somebody who has no need to go for a invasive or a non-invasive CT angio should probably not be going for it. So I would say if you've had COVID, you've recovered from COVID, whether you're symptomatic, asymptomatic, meet your doctor, meet your cardiologist if you have access to one. Let them assess you, let them evaluate you, and then if necessary, you go for a treadmill or a stress test. Otherwise, do a baseline cardiac workup, look at your cholesterol, look at your sugars, look at, because many of these patients have developed diabetes either due to the stress of the disease or due to the use of steroids, and these kind of things need to be corrected first, and then you go further. Hypertension, we've seen non-hypertensives become hypertensive, we've seen hypertensives having normal BPs because of various course of the disease. So meet your cardiologist, let them take a decision. Don't go for stress test directly based upon whether you feel or somebody, your friend has told you, अरे यार चल रोज जिम में TMT करते हैं, जाके चलो एक बार TMT करेंगे. So that will probably do more harm than good.
The next question to you, I think quite valid, that you should not take a decision yourself. I think you need to consult your doctor on how often you should need your heart to be evaluated. But basically, I think people should take their blood test done, a basic complete blood picture, so that they get at least a basic idea of what's happening.
At least once in 6 months. Once in 6 months, yes. If you're symptomatic, maybe even once in 3 months. If it's an asymptomatic person, once in 6 months. A younger person who has had a completely normal first baseline check, even once a year is fine.
Yeah, Hyderabad was also the center of one of the largest studies in the world on mitral stenosis done by NIMS in collaboration with a team from the US. I think Dr. Raju headed this particular study. Now, it's mainly due to rheumatic fever in early ages. What is the situation now in the light of COVID?
COVID per se has not been found to increase neither the incidence nor the progression of mitral valve disease. Mitral valve disease is predominantly rheumatic. There are certain other degenerative causes also, but COVID per se has not been found to affect the incidence of mitral valve disease in any way. So in India per se, the West is probably they've forgotten about rheumatic heart disease, but in India it is still a very major cause of debility and disability going forward. And especially in the lower socioeconomic age, groups where there is a lack of hygiene, they have more of these group-based streptococcal infections in childhood. There's a famous saying, by Boyd, who said that rheumatic fever licks the joints but bites the heart. That's because the child presents with sore throat, fever, and joint pains that classically move from one joint to another, and then probably 5-10 years later they develop mitral stenosis or any other valvular disease. So the COVID per se has not been found to affect.
I will reframe my question. My question was: if suppose a young patient who has rheumatic fever but has not used penicillin, but also had COVID at that particular time, does this change the profile of the person so far as mitral stenosis is concerned?
Per se, no. See, COVID will affect him if he has COVID. He develops myocarditis. If he has COVID, he develops LV dysfunction. In the presence of mitral stenosis, that can lead to more incidence of heart failure. It can lead to increased hospitalization. But as such, somebody who's taking penicillin prophylaxis needs to continue to take it, irrespective of whether he develops COVID or not. And COVID will affect this if he has developed a sequelae of COVID, like LV dysfunction, or if he has accelerated coronary atherosclerosis leading to coronary artery disease. These can all lead to symptoms. But as far as the virus is concerned, I'm not aware of any data published so far.
Fine. I'll just go on to another question, which probably would interest Dr. Goyal also. We often hear that people say that their heart is an open book. Well, now it's literally so. Keeping tabs on your health with apps that track your heart rate, blood pressure, fitness, endurance can reveal a lot about your heart and efficacy of medication, lifestyle adjustments, and other treatments. These tools are trusted favorites of researchers and cardiologists. What are the advantages and disadvantages of having this app, especially in times of COVID, where everything becomes an open book?
It's actually a very what do you say? It's a great invention. I feel it's something that can make your life really easy, but at the same time it can also make your life really miserable. Depends on how you look at it. Because we've had patients who have their pulse oximeter plugged in 24 hours, and then if they have access to your phone number, then best of luck, because you will get a call every hour saying, "Doctor, my heart rate is 65. Now it is 95." Then it became this. And if you have a sleep tracker or a fitness tracker, they call you up saying that my heart rate became 40 during my sleep. So see, these things are normal. See, in science, nothing is absolute. We hear that the normal heart rate in schools you are taught is 72 beats per minute. That is not so. It is 60 to 100 beats per minute. It's always a range. Okay, your normal might be different from my normal. So each of us has a range, a physiological range, so to speak. Now, another problem that comes in with these pulse oximeters is that sometimes, especially in COVID, we've seen a lot of people developing something called extra beats or ectopic beats. Now, these are very often benign. There's nothing to worry about. What happens is sometimes these extra beats come 1 and 2 beats. So if your heart rate is 70, it will be 35 normal beats and 35 ectopic beats. So when you put in the pulse oximeter, many of these pulse oximeters are not sensitive enough. So they pick up only the normal beats, and it will show you your heart rate as 35. And the patient gets alarmed and runs to the hospital where they take an ECG and they say that ECG is abnormal. So it causes stress. So this is the downside of it. The good side of it is you can monitor your heart rate. Somebody who is at rest and finds his heart rate has gone up to 150. That is an alarm. So especially elderly people who have episodes of giddiness, elderly people who have unexplained strokes, especially these watches that can detect the medical condition known as atrial fibrillation have come as a blessing for us, because many times patients land up with recurrent strokes and you're not able to find anything in the hospital evaluation. So we actually recommend people like this to get a watch that has a AF detection technology on it, which even captures the ECG as well during that time. So if they find that their heart rate has shot up all of a sudden and it's irregular, they just need to record their ECG and they can transmit that to us via the app or as a PDF. And there, if you catch the AF, there you can start them off on anticoagulation, which you would not be having evidence to do so otherwise in the absence of this. So there is a definite benefit to it, but then everything needs to be taken with its in a pinch of salt. You can't just say that this is without any flaws or that is without any benefit. So there are pros and cons, and I think with prudent use, technology will definitely help us, and that is the way going forward. I think patient education really helps here, rather than just as I told you, they keep calling you and telling you. I mean, instead of me telling them that "Arey kuch nahi hai yaar, don't trouble me," if I just take time out 2 minutes to tell them that, "Bhai, don't worry, see, your normal heart rate has a range, it's 60 to 100. Anything between this is fine. Inform me if it is less than 60 or more than 100." They are happy, they understand. He'll tell somebody of his own also the same thing. So I think we have moved beyond the era where we tell patients, you want to listen to the internet, you go take treatment from there, to coming up and telling patients, actually, at least what I do is I tell them, this is your disease. You have a lot of information available online. You have videos on YouTube. You have literature available on Google. You Google it, you look at it, you come back with your doubts. Because I am happier if they come back to me with their doubts and I can clarify them, rather than they receive a WhatsApp forward from somebody and they end up believing that and stop the medication. So I think we are in the era where we need to embrace technology.
Yeah, quite right. It's a double-edged sword, of course. We can have a long discussion on this, because this will also be.
I think Bedi sir can really add to this with his vast experience.
I think Dr. Bedi is actually waiting to answer this, I think.
Yeah. So that's why, Mr. Shankar, sorry to interrupt. That's why we have Dr. Goyal from Chicago.
Yes. That's why I said it will interest him also. Yes.
Beautiful AI technology for how we can make this sort of digital clinic available at workplaces, corporates, RWAs, and even in hospitals. They are now putting in India where you can have instant ECG, and they're all sort of validated scientifically. Instant ECG, instant BP, and a lot of other things, which we'll cover in this talk later on. That's why I request everyone to remain with us for the talk. He's waiting till midnight to deliver that talk to us. So my question, a little tricky question. Sir, Bedi sir, do you have any comment to make on what Dr. Azam said, sir?
No, nothing additional. I think we can move forward.
Oh, okay. So my question is with Professor Kashyap. So you're there, sir, Professor Kashyap?
I'm there.
Sir, a little tricky question, and this has been going on rounds on the WhatsApp. So I thought it is a WhatsApp gimmick, or then I also cross-checked in the US government dietary guidelines of 2015-2020, cholesterol was removed from nutrient of concern. The American College of Cardiology said there was not enough scientific evidence to show that limiting dietary cholesterol lowered artery clogging LDL cholesterol in the blood. The AHA's previous advice suggested limiting dietary cholesterol to less than 300 milligrams per day. Does that mean that there's no significance of bad cholesterol? Rather, it's important to prevent saturated fat consumption to prevent heart disease by clogging. So what is your view on the cholesterol? So is still the 200 milligram less cholesterol, or we should consider 300 milligram? Because it was a guideline from Ministry of Agriculture, not from US FDA. So I thought from your experience, you can maybe share something.
I'll answer this question in a very specific manner. But before I do that, I'll prime your perception by two quotations spread by almost 2.5 millennia. A famous German scientist, Max Planck, said that science progresses one funeral at a time, because there are established gurus, they are chiefs of panels and expert guidelines. They do not get rid of their notions which they've propagated for 20, 30 years suddenly. They will always find ways to keep retaining that, and it doesn't change easily. Shakyamuni Buddha answered this very well 2,500 years ago. He visited a community called Kalamas, and they asked him that there are so many gurus, somebody tells this, somebody tells that, then someone comes who's more knowledgeable, who's got bigger tilak on his forehead, and he says something very different. Now, whom do we follow and whom we do not follow? So he answered, which is a very famous Pali canon, and I'll reproduce Kalama Sutta. Do not believe in anything simply because you've heard. Do not believe in traditions because they've been handed down for many generations. Do not believe in anything because it is spoken and rumored by many, which is applicable to our social media, WhatsApp University. Do not believe in anything simply because it is found written in your religious books. That covers guidelines also sometimes. Do not believe in anything merely on the authority of your teachers and elders. But after observation and careful analysis, when you find anything that agrees with reason and is conducive to the good and benefit of all and passes the test of truthful reality, then accept it and also live up to it. Now, having said that, it is amply cleared for many years, almost a decade now, that dietary cholesterol has got nothing to do with serum cholesterol or the cholesterol which is found which block our arteries. That is a sum total of long-standing inflammation and many other influences. Now, when we do a test, it is a snapshot of a moving target. And if you start doing statistical analysis, some trends will come out, and that may be at best data mining, or at worst, it could be very misleading. Now, the real culprit is processed carbohydrate devoid of fiber. When we have insulin resistance, insulin spikes, insulin signaling, the carbohydrates are converted into bad fats by liver. It does not come from diet. So there is a tug of war going on between US Department of Agriculture and the professional medical guidelines. I believe, this is my personal opinion, after careful scanning of literature and studying epidemiological studies in recent past, that these two combatants are on the same side. They do not advocate plant-based fiber-rich diet, or put it in a more succinct, clear manner, they do not speak against ultra-processed food at all. The real culprit is ultra-processed food. It could be vegetarian, it could be non-vegetarian. So sometimes when we are discussing things, we pick out a metric which is downstream in a long cascade of events and phenomena. We may get the wrong message, and when we start doing investigations to test that or capture that on some imaging technique, it is at best a snapshot of a fast-moving target. We can be misled also. So my answer is that all these metrics, there are communities which have high cholesterol and do not suffer heart attacks. There are communities which 50% of fatal myocardial infarctions have normal cholesterol. But LDL cholesterol is now firmly bedded in our psyche, and it will take a generation, as Max Planck said, it takes a generation to change your views and practices. I can give few examples unrelated, not from cardiology because I'm a cardiologist. Long after it was known that tonsillectomy is not only not beneficial, but is harmful and was almost a rite of passage into adulthood, tonsillectomy continued to be practiced on kids till that generation of ENT surgeons disappeared and cochlear implant surgeons came in. Similarly, thyroid surgery for Graves' disease. Long after it was known that the medical treatment is far superior and you should not touch thyroid gland of a Graves' disease patient, partial thyroidectomy continued to be practiced till those surgeons disappeared. Same thing goes for peptic ulcer surgery. Do you come across anybody for peptic ulcer? Symptoms theek nahi ho rahe, uski surgery kar di? No. So there are many things about cholesterol. I'll leave it.
So you mean to say that the change will be really brought in by the next generation?
Change is already there. Change is already there. It's a very personal thing. I lost a brother because of heart attack in his late 30s, a brother due to cancer in late 40s. I myself was overweight. I went very deep into nutrition and nutritional science. First thing I realized, as my professor Manchanda used to say, my teacher, that doctors know almost nothing about nutrition. And it is true, I did not know anything about nutrition till 5 or 6, 7 years ago. And when we changed our nutrition, and my community was also changing in good measure, I lost weight. From 104, I came down to 67. My waist size came from 42 to 35. And I eat a lot, but it's all different kind of stuff. So you remove processed carbohydrates and ultra-processed food, come on fruits and vegetables, take a lot of ghee, but it should not be fried. Raw ghee is good, fried ghee is bad, period.
Thank you.
So farmers who used to practice, I also come from rural feudal background. I can tell you that not too long ago, farmers used to stop farming when they became grandfather, which was in their early 40s or mid 40s. And thereafter, they lived for 50 years just eating and gossiping in panchayat chopals. They did not put on weight. Nobody puts on weight because of overeating. This calorie paradigm is a great myth. It is continuing, though some people are puncturing it in academia. One puts on weight because of wrong eating. Exercise is very good for health, for all our systems, but it's a very poor measure for reducing weight.
Thank you, sir.
Exercise, I can just leave you with one good medical anthropological data to buttress my point, that we have very reliable data from medical anthropology that when boys were enrolled in armed forces, boys of same height, same age, and same ethnicity weighed just the same with few 100 grams here or there. They did not eat by calibrating their calories intake. All mothers were not equally good cooks. All did not have the same degree of affluence. So, and in the wild also, all other mammals, they do not become overweight if there's abundance of food. Normal food just doesn't allow you to become overweight. Wonderful. And all that is eaten is not necessarily food. That's it. Thank you.
Wonderful message, though philosophically explained by you, but very brilliantly articulated, sir, and it's very useful for us. Really sorry to hear about your personal losses, but it was wonderful having you here, sir. I will move to Dr. Bedi. Dr. Bedi, sir, what would be your health resolution message? And before your health resolution message, sir, Dr. Bedi, are there, sir?
Yes, very much. Can you hear me?
Yeah. Right, sir. Right, sir. So also would like to, from your experience, like to know about these, because now we are seeing this anticoagulant to the steroids, the antivirals, the the antibiotics and all these antipyretics, everything has the uses has shot up in this time of COVID because of the real usage, because of the medication required. A lot of trials and hit and trial runs have been happening, and of course because of fear factor also, a lot of over medication, over the counter medication there. So do you think do you see the linkage of these over medication with the increasing incidence of heart disease?
Over medication related to COVID and heart disease, no. If anything, we give anticoagulants to most of our patients who have COVID, and that, if anything, can protect to some extent against heart disease. So I don't think, other than steroid, of course, steroid has so many side effects, including cardiac, which if you start a patient on steroids, then you have to monitor his blood pressure, his sugar, and by default his heart. Now, if you may permit me, there is one very common question which is asked by heart patients. So since this is heart and COVID, and which is, sir, can I get my vaccination? So can I speak for 2 minutes on that? Yeah, see, all my patients who have, I'm a surgeon, who have had heart surgery, they are always worried, should they have vaccines? Now, it is imperative that a heart patient, whether operated or not, whether stented or not, should get a vaccine as per our current knowledge. So my message to your viewers, who I believe are quite, most of them are not doctors, is that yes, you must get your vaccine. Antiplatelet does not matter. Aspirin does not matter. But if you have had a heart valve surgery and you are on a blood thinner like acetylene, then you must monitor your INR, which all heart patients who've had valve surgery know. And if it is below 2.5, then you can get your vaccine without any problem. If it is more than 2.5, then better to avoid. So this is my message to heart patients related to COVID.
Yeah. So as we know, Dr. Goel has been waiting from Chicago and has got a beautiful breakthrough technology. I personally got so convinced about it. Its uses particularly in corporate wellness and the cardiovascular health. So we'll quickly have a round with Dr. Goel and his video and his presentation very quickly in 10 minutes. But I would request Ms. Jigna and Dr. Azam to stay with us. Ms. Jigna, I definitely have a question on the good and bad food, particularly the saturated fat and the starch and the carbohydrates, which have been discussed. Your last message on it. Dr. Azam, I would definitely like to hear from you on the difference between heart attack and a cardiac arrest, sudden cardiac attack, because there's a lot of confusion still, people, and your message on that, particularly the CPR and other things, what people should learn and do about. So I would give it to Dr. Goel. Before that, we'll just quickly play a quick video on his revolutionary technology HPOD, which is brought to India, now getting very popular in India. Can we do that, my admin team, the video?
World tends to symbolize doctor care as the healthcare and the well-being of people have been limited by the provider system. India HealthLink offers the first ever connected user-centric healthcare ecosystem through its advanced digital platform and award-winning health station HPOD. We have built an end-to-end wellness fabric to account for holistic care of everyone in the family. Here we look at the family of Neeraj, who lives with his wife Mona. Parents and kids at their housing society offered IHL Care Neighborhood, and they all signed up for IHL Care. Neeraj mostly travels for work, and on one of such trips he fell sick. He searched for a nearby HPOD and found one at the pharmacy. He quickly checked his vitals, including BP, temperature, ECG, oxygen saturation, and body mass composition in less than 5 minutes. Did a video consultation by sharing his health records and symptoms with the doctor, got the medication prescription, and collected medication from the pharmacy. He later shares his experience with his family. Mona, his wife, works at IT Private Limited. Her company has provided IHL Care Wellness to their employees. She gets a routine reminder to do her screening. She gets the health check done and schedules a diet counseling session from the IHL Marketplace. Later she finds the sponsored classes offered by her company on IHL app and enrolls for a yoga session to do along with her colleagues. IT Private Limited was able to improve the overall health index for their employees and are rated among the top employers to work for. Neeraj has a family view enabled on his IHL Care account and sees some concerning activity on his father's profile. He immediately schedules a blood check at home for his father and asks him to upload his prescription to get medicine delivered via IHL app partners. His parents are happy to have the convenience of IHL Care in their neighborhood. Daughter Tanya, while shopping at her favorite store in a nearby mall, gets an IHL Care coupon as a loyalty award. She gets a complete screening done to keep track of her health vitals. A new kind of healthcare ecosystem is needed to cater to 1 billion plus people in India, so we built it. Your health is our mission, leading the charge for healthy India. One nation, one platform, equals IHL Care. Find the nearest HPod in your enterprise, housing society, hospital, clinic, gym, yoga, Zumba, shopping mall, movie theater, railway station, and airports as well. Download the IHL Care app now to address all your healthcare needs.
Over to Dr. Goel from Chicago. He will quickly take us through the presentation, explain about this whole program. Particularly, Dr. Goel, we'd like to know how it complements and supplements the role of the doctors, cardiologists, and the hospitals and clinics in providing better preventive heart care for the society. Dr. Goel, over to you.
Thanks, Dr. Srivastava. And I'll just start with this couple of things, which is the pertinent to the topic which we started discussing today, COVID and the cardiovascular impact. What is happening? COVID is a double whammy in general, because people who are already have comorbidities like hypertension and diabetes and cardiovascular diseases, they are the ones who are basically most impacted. At the same time, because of these lockdowns, lifestyle of people have changed. And again, the cardiovascular diseases are being built. So if COVID have done something, it actually has highlighted the need for preventative healthcare, and that saves life and can build the community stronger. So just the reason why IHL Care come into the picture and why we are what we are trying to solve is basically India, like the rest of the world, the non-communicable disease burden is very high. And what we believe, the most can be prevented by access to basic healthcare, education, and vital information. So if nothing, what we are singularly trying to manage here through IHL Care program is we are trying to empower people with this information, with their health information, before it is too late. And just 3 pillars of our program, and what we call IHL Care, what the 3 pillars of our program is, it's human-centered. So we build the system around people, and what we are giving them first-time access to what we call health account. Similar to how everybody has their email accounts or bank accounts, they should also have their health account. Now, health account is theirs to keep, theirs to manage. They can enter the information, whatever they have on themselves, whether it's a blood report, doctor consultation, any kind of vitals data, whether they are using any watch, using anything on the phone, whatever they are using, whatever information they have on themselves, they can use that into their account. And their account is data powered, it's intelligent account, which can take the data and give them the picture of what we call education awareness, how they are, on what spectrum their health is. We have what call IHL health scores that tells them whether they are healthy, they need assistance, or they are in a certain stage where they can just get some guidance and get better. The second pillar, which will come to the H part, the first one, but the idea is collect, collate, consult. The next pillar is users get the information about themselves, about their health. The idea is what next? Now I have a question. Maybe I want to do something about it. I don't know. Like the panelists were saying, they always reach out to doctors for the things they don't know. Now the technology itself is telling them a lot, but obviously there are questions which technology cannot answer. So then we built a marketplace where we allow anyone, whether you are providing a telemedicine consultation, you are providing online pharmacy, medicine delivery lab, or even yoga, or providing mental health counseling, diet counseling, any kind of services which is health related, is right there on your phone. You can decide who to consult with, and that recommendation is coming from your own account. But more importantly, what's missing in India right now is that the accessibility to capture that 95% of vitals, which are crucial to your health, in the ease of your own, at your own ease, in the ease of your own comfort. Whether you are working in a company, you go to a cafeteria. Whether you are living in a housing society, you should just go to a wellness community hall, or you are in a gram panchayat in a village, you can go to a nearby pharmacy, or wherever you are. You should be able to screen these vitals at ease and without any intervention, without any paramedic assistance. That is where we are bringing this scalable HPOD, which is one of a kind, clinically validated system, which within 3 to 5 minutes, without any assistance, can screen blood pressure, 6-lead ECG. It can do temperature, oxygen saturation, full body composition, height, weight, as well as the BMI, just a general calculation. And all that is done in it's language compatible, and it's all accessible system. So these are the 3 pillars that we are allowing the end-to-end journey of every user in India. We are not calling that IHL care is for patients. We think that IHL care is for everyone. And just the snapshot of what I was just saying, HPOD which we're bringing, it's a small ATM size machine. Anybody can put it wherever they want. The entire platform is cloud managed. It's the HIPAA certified, which means the data which we are capturing, it belongs to the user, and it is secured and private from our technology itself. The technology which we are bringing, this is the first system in the world which is clinically validated in India for a year. So one thing which is coming back to one of the panelists, the question, everybody have these devices at home right now. Blood pressure, buying a blood pressure machine is not that expensive. Oxygen saturation, everybody has it in their hand now. COVID has made it easy and accessible. But the problem is not everybody can use it right. Most of the time, the readings you get at home, you are not taking it right, not in a right clinical way. That is what we make sure this heavy kiosk actually is clinically validated. When you sit on the kiosk, we make sure the readings you are captured or we are capturing is clinically grade as equal to you will get in the hospital via a nurse. Just a view of the health account we talk about, it's gamified system. So it not only actually captures the data, allow you to store the data, but it's your account in perpetuity. You can use the data whenever you are consulting to a doctor. So right now, people talk about telemedicine. But in telemedicine, when you're calling a doctor on a WhatsApp, you're only able to tell them your symptoms. But most likely, they need to know more. And that's what this health account allows them to do. So when you are doing a consultation, you can share any data on your account to anyone you want to. And during that, whatever happened in that particular event and the consultation, all that comes back to you. And so all of your data stays with you all the time. I'll just move. So just to give you a conclusion of what we are bringing here, this is the health of what we have done so far. This is the health of state in India, state of health in India. I'm just showing you a simple snapshot of 4 different locations. So we have systems in a corporate office, in a tertiary care hospital, in a fitness center, in a gym, and in a rural hospital as well. If you look into the overall average demographic vitals, you can see the 70% of the people actually are in an orange or a red zone when you talk about the obesity. And more than 50% of the population is hypertensive. And surprisingly enough to us, the stats at a corporate office as equivalent to in a tertiary care hospital where mostly patients are going. So this is what we are all talking about. Generationally and Indian culturally, we ignore the factors of hypertensive, obesity, diabetes, how they're making the long-term diseases more chronic. Why we are getting so many heart attacks? Why the mortality is happening because of NCDs? Just because we do not take care of ourselves when it is the right time. So going back to IHL Care mission is to empower everybody with the knowledge, education, the awareness before it is too late. So Dr. Srivastava, you mentioned we just launched a new program where we are employee cardiovascular graph. So we are making a concerted effort and calling on to all the corporations, provide this easy access of screening to all of your employees so that they can actually be aware of their health. Simple stress management and understanding what's going on with them. they can avoid so much of mortality, so much of so much better they can do for their employees, which has not been able to do beforehand. Because we as Indians don't have a habit to think about doctors until we really feel sick. But our body does not tell you you're sick until it is too late. So with that, I'll just I'll end my conversation here. But happy to provide more information to anyone. There is a website address and our email address as well as phone number. So again, yes, go ahead.
Dr. Goel, can you go back to the data slide of what you had shown this one? Yeah. Any specific data points which you feel is useful for us to know here in India, which have come out from your experience till now?
That's what I was mentioning on this slide. So basically, if you look into this slide on the left side, this is the data from India, around 50,000 people, the data we are showing you aggregate. In this, if you look into the very leftmost pie chart, that is the obesity, the obesity chart. If you look into it, only 30% of people actually are healthier. 25% are already obese, and between 40 to 45% in the what we call orange zone, where they will become obese if they don't take care of themselves. And more important than that was the hypertension. Hypertension rate in India is more than 50%. That is too bad that so many people, young people, are stressed.
Wonderful, wonderful. So that's very useful. Like to have more details on this data, and because a lot of health media which they cover our sessions, they would like to have more data on it. Thank you, Dr. Goel. And sorry, we have extended our time, so not many questions to take. We'll keep having you on our sessions from time to time, because role of digital is becoming important, particularly helping people and supplements the doctors and healthcare systems in our country to help people to have a healthier life. So, Dr. Azam, my question to you, can we stop sharing this?
Yeah.
Thank you. Dr. Azam, my question to you, sir, on the this discussion and deliberation on heart disease is incomplete without, because this is one of the commonest thing people confuse is the heart attack due to angina, blockage in the heart, and the sudden cardiac arrest, which is a more arrhythmic related problem. So what is your view and the message for people to differentiate and what to do in each case if such symptoms?
See, basically you have to understand one thing. Heart attack is a term which is very loosely used amongst the general public. कोई भी चीज हो दिल का related जैसे attack आया. Basically, medically अगर देखा, if we see, then heart attack means whenever there is an abrupt cutoff to the blood flow to the heart, it is called as a heart attack. Now, many people have this wrong notion that if their ECG and 2D echo is normal, that means they don't have a block in their heart. So जब उनको heart attack आता है, they wonder कि अरे एक महीना पहले ECG 2D echo normal था, तो मेरे को heart attack कैसे आ सकता है? This is a very common thing. What you have to understand is that an ECG and an echo can even be completely normal, even if you have a 90% block in your heart. Because even if it is blocked 90%, the flow will still be there. So you will develop symptoms when you walk, when you do exercise, when you climb stairs, symptoms like chest discomfort, sometimes burning in the chest, which comes only on walking, sometimes feeling breathless, which is there on walking, sometimes after eating food, sometimes while sleeping. So these can all be warning signs that you are going to get a heart attack. Now, when the person gets a heart attack, what happens is that 90% block becomes 100%. Matlab, there is a total cutoff of blood flow to the heart. Very often it presents with sudden severe chest discomfort. Sometimes it can be throat pain. Sometimes it can be back pain. It can be shoulder pain. Very rarely it can even be pain just below your chest. It is often associated with a feeling of not able to breathe or a choking feeling. There can be unexplained sweating. Okay, so these are all signs that the person is having a heart attack. Any chest discomfort, any kind of unexplained sweating, I always tell my patients, go to your nearest clinic and get an ECG done. These health pods, H pods that we were just discussing are probably going to be lifesavers because you go get an ECG done, even if it's a 6-lead ECG, it can give you a lot of information, at least help you to rule in or rule out an emergency like a heart attack. Now, in a major heart attack, you can develop arrhythmias, which will lead to sudden collapse. Second thing, the cutoff in blood flow can be so severe that the heart can completely stop. So when that happens, it is called as a sudden cardiac arrest. Now, a sudden cardiac arrest can either be because of a heart attack or it can be because of an arrhythmia. Now, an arrhythmia means the heart has its own rhythm, like we would have learned in school, no? Lub, dub, lub, dub, lub, dub. That's the normal rhythm. Sometimes what happens, the heart starts beating very fast. Instead of beating between 60 to 100, the heartbeat goes to 200, 250, sometimes even 300. So the heart which should beat like this, lub, dub, lub, dub, lub, dub, now starts beating like that. So that is called as ventricular tachycardia. In some very severe conditions, it is called as ventricular fibrillation. Now, as you can see, if the heart is beating like this, there is no blood flow coming out of the heart. So there is no blood supply to the brain and the person just collapses. Now, what should you do when you see somebody in front of you suddenly collapse? What you need to do there is something which is going to be life-saving, that is known as CPR or cardiopulmonary resuscitation. Cardiopulmonary resuscitation or CPR has 3 steps, A, B, C. A meaning airway, then you first check whether anything is obstructing the mouth. Check whether he has eaten something. Very often you see at restaurants people start choking because they take too big a morsel of food, or they take food while talking and the food goes into the airway. So that is called as check the airway. Put your finger in the mouth, try to take out any obstruction. Next is see if the patient is breathing or not. And third one is do chest compressions. Now, recently, in the last couple of years, 3-4 years, in fact, not so recent, in fact, the ABC has now been changed to CAB, meaning cardiac compressions come first. So, if you see a patient who has fallen down, who has collapsed, the first thing you do is call for help, make a noise that somebody call the ambulance, and immediately go and start doing chest compressions. Now, CPR is something that is life-saving, and we recently had a program at KIMS where, we had a program for common people, for laymen, for everybody, from IT industries, from normal security guards, people who are working as drivers, people who are working as cooks, people who are working as house help, everybody. So the aim was every house should have one person who is trained in CPR. And I feel throughout the country, if we do this, it will really help in saving many lives. The second thing is you should know how to operate an automated defibrillator. Many times you see in airports when you go, the next time you go, you should pay attention. You have these red boxes on which it is written as AED. Now, those are known as automated defibrillators. So when the heart is beating like that, it's known as fibrillation. So the defibrillator gives a shock. That shock brings the heart back to normal rhythm. So these automated defibrillators are completely automatic machines. All you need to do is take that thing from the box, from that red box, follow the instructions, put the sticker on the person's chest, switch it on. It will analyze the rhythm and it will shock the rhythm. If it is shockable, bringing the person back into consciousness. So these two things are life-saving. If you are not trained in CPR, you will have umpteen CPR programs in the city. And I feel even as doctors, as clinicians, we should start having more CPR programs for common people rather than just training our own fraternity, because any MBBS graduate, the majority of them at least, will know how to do an effective CPR. But what you need is every household should have one person at least trained in CPR. So in your own apartment complexes, in your own societies, in your own colonies, you should have more and more such CPR programs. So that is basically the difference. A heart attack can cause cardiac arrest, but not all cardiac arrests are because of heart attacks. That is important.
Very useful information, Dr. Azam. You rightly said we should also, at Health4All, will start looking at doing such dedicated sessions, even for 10 minutes, 15 minutes for CPR training, how to use AED. So these will definitely be useful going forward. Before I end this session with my last question with Dr. Bedi, I have one question with Ms. Jigna. She has been there for long. Jigna ma'am, I would like to know, particularly in the case of COVID, situation for the last 2 years. There's over binging happening. Zomato and Swiggies have become much more popular and rich in the time of COVID. So, what is your message in the new year, particularly with respect to the good food and the bad food, which you can avoid even while you are at home?
Yes, as you rightly said, because last 1.5 year, when everybody's sitting at home or there's a work from home situation, the two things that you can think of is only work and food. So people had only two things to think about or do is food. So where the message that I want to give to all the people, that even if you're working from home, choosing the right food is very, very important. So as a rule, we dietitians normally would recommend what to eat rather than what not to eat first. So first I will talk about the good foods that you should be taking, and my advice is that go for a small, simple meals which are home cooked, wherein you include a lot of fruits, fresh fruits and vegetables, cereals, which are whole grain cereals. As one of the panelists also mentioned that we are India, we have become starchitarians. So when it comes to starch, your calories, the main calories coming are from carbohydrates that we eat. So when you are choosing your carbohydrates, you should be very wise enough to choose your cereals, especially whole grains, pulses, legumes, fresh fruits and vegetables. I would also recommend you to include a lot of good amount of protein, but a lean protein. And when it comes to fats, limit your fat intake, because we all know that we are not doing a lot of work or any physical activity. So limit your fat intake, specifically the saturated fat, the refined food. So when you're ordering, anyways, if you're ordering from Swiggy or the other options, choose the food wisely. So don't go for any refined products or cakes or pastries or pastas. Even if you have no choice, and if you cannot cook at home, try to go for a low fat vegetables or plain rotis instead of bread. I would recommend to cook some rice or chapatis at home. Try and make a few salads. Keep your refrigerator full with all the fruits. In fact, I would also recommend that a lot of people who are having a habit of munching while they are working, so munching is something which is another cause for obesity and other illnesses. So when you're munching, try and go for non fried snacks, or best option is your nuts and seeds like the almonds or walnuts. So that is I would recommend, and most importantly, hydrate yourself. So one of the sessions we also said that hydration is going to be very, very important. So while we are at home, we forget to drink enough water or enough fluids. So have your fluids handy, keep your bottle filled with water, include a lot of soups, a lot of liquids in terms of buttermilk and all that. And most importantly, refrain from any kind of simple carbohydrates, fried foods, refined foods, high calorie beverages. Go for something which is moderate calorie food, and most importantly, along with the have some stretching and some exercises. Get up from your seat and use your calories, which is very, very important.
Very useful. Professor Kashyap, I think, sir, you agree with what Miss Jigna has said? You're on mute, sir.
With her, but I just would like to add one point which I was waiting for that question, but since it didn't come, so I think I'll make little. Before I forget, I want to just declare that I have no conflict of interest. I have not received any grant from any of the sponsors here. Now, coming to very important point about COVID, nutrition, everything is smoking. In India, tobacco kills 1 million persons every year, and half of these are cardiovascular deaths. But tobacco is known only for cancer, which is responsible for about 10% deaths. Cardiovascular disease kills patients in their prime. Now, how is it linked with COVID? Initially, the tobacco industry, because they are past masters in this, they actually got papers published that tobacco's consumption gives protection against COVID. Fortunately, there were alert people in the medical academia and various bodies. All of those papers have been retracted, all. And World Health Organization Chief Dr. Tedros put the record straight on 31st May this last year on World Tobacco Day, that tobacco increases vulnerability to infection by 1.5 times, and complicated illness, mortality, etc. twice. So mortality is twice among smokers. And here, the active ingredient of tobacco, that is nicotine, impacts ACE2 enzyme. So that ACE2 enzyme is the final gateway. So those who do not smoke, smoking not only through this mechanism, it increases hand to mouth contact. It leads to sharing of cigarettes. So the same object is being passed from one person to another, apart from decreasing mucociliary clearance and making you vulnerable from many other reasons. It also acts of angiotensin converting to enzyme. So that is one. Secondly, plant-based diet, as Dr. Jigna said, she's elaborated, but I'll just add a little minor point. Just because something is plant-based is not necessarily healthy. We must realize that Coke, Pepsi, all are plant-based. They have caffeine. Cocoa, they are from plant sources. Even opioids are from plants. So anything which has been processed and the nutrients and phytonutrients of plants have been destroyed by processing, ultra processing, or even home cooked in a wrong manner, which she's already alluded to, take away the benefits of nutritional protection. So that should be kept in mind, and I'll stop here. Thank you very much.
Thank you. Very useful again, sir. Dr. Bedi, sir, you are so popular in Chandigarh and Punjab, and we have also seen a lot of health education you have been doing through media. So it would not be right to say that being a cardiac surgeon, your focus is not on preventive health, because you're already doing so much of health education, I believe, sir. So what is your view on this technology which Dr. Goel presented, or any such digital and technology which can improve access to diagnostics, as well as play a very substantial role in supplementing the one is, of course, bringing all data together for better analytics, also giving a sort of reminders to people on a regular basis to go for regular checkups, or what to eat, what not to eat, supplementing in overall healthcare education. So what is your experience in the past, and what is your view on such a thing?
See, I think in today's age, what Dr. Goel has shown is imperative. It's going to be mandatory, because see, we can operate on an X number of cases. My colleagues can put stents in maybe thousands, maybe lakhs, but the number of our patients is much, much more than that. So our stress has to be one, prevention, and two is, if it happens, to catch it early. And very easy to catch it if you have screenings or even self-screening. So that is, I think it is imperative. It is the need of the hour. I would also like to stress over here that quite a number of patients, mine, and I'm sure equally in Delhi or Hyderabad, they will ignore their earlier symptoms. They'll say, oh, mere ko to gas ho rahi hai. And they'll take some cold milk or cold water and wait, and they are actually developing a heart attack. So my message is, please, if your gas does not respond within 5 minutes of taking an antacid, please see your local doctor. And the local doctor, just by examining you, your symptoms, and doing a simple ECG, which is available in every village also now. And he can, if nothing else now, maybe I missed a part of Dr. Goel's presentation. Maybe he can send that ECG, the MBBS doctor, or even for that matter, a primary healthcare worker, to a specialized center, and he can get your diagnosis and at least initial therapy. So we have to reach out to the common man, and this IT-based technologies are really, really going to help us very much. So I'm all for it. Definitely.
Wonderful, wonderful. Yeah. Dr. Goel, can we end the session with your message, particularly on judicious use of technology and digital, and how it can be very useful in preventive health, preventive heart care? Yeah.
Sure. I mean, and Dr. Bedi was saying that, right? So the simple message for everyone is and Dr. Other panelists also said, the education awareness. So I think the openness today for accepting the technology is there in the medical fraternity. But that's what I am listening here, and that's what we are seeing in India. Because India is so vast and broad, the only way to manage Indian population is to combine that together. So I think my last message, the final message is that just keep your eyes and ears open to the ideas that the simple messages, simple actions can actually give you the larger benefit. and don't ignore. Preventive is the new cure. So it's the preventive. Understand yourself and then take an action accordingly.
Thank you, all the distinguished panelists. We had a wonderful session. We overshot by almost I would say 50 minutes or so. So, but it was really wonderful. There's no way to stop in between. We'll keep having such invigorating sessions in times to come. And this platform we have every Sunday 8 a.m. to 11 a.m. where we cover various aspects of wellness, various health issues, disease prevention issues, and of course it's not only about COVID, it is about a lot of other important diseases which are ignored and which should be brought at the forefront. And that's why this session on cardiac health today. And we have this live going all over the world on a very popular YouTube channel, and Facebook Live is in fact picking up very fast, growing the numbers, multiplying every week, going to thousands and lakhs of people across the globe. So with this, if you have separate questions for any experts, we will definitely get back to you with the questions. We have separate videos cut out after the sessions, which we'll share with you, which everybody can propagate for a better reach and better education for the people. With this, I thank you again, everyone. I give it to Mr. Shankar to please end the session with our quiz answers and the announcement for the next Sunday session.
Thank you, Sudeep. I completely agree with you that this is a wonderful session. There was no way of shortening it. I think, in fact, we could have expanded it rather. But for the time constraint that we are forced to stop. Now we have quiz. We actually moved from the heart to technology and technology to diet, and we covered almost all the entire gamut of COVID and heart ailments. So now we have the second quiz. Quiz number 2 is, which of the following symptoms appearing post-COVID may indicate heart disease? A, severe chest pain. B, feeling lightheaded or dizzy while standing up along with nausea. C, chest palpitations. And D, all the above. Now, usually there is a gap between the quiz and the answers, but I'll move on to the answers now. For answer to the first question, first quiz, the question was, which of the following statements are correct regarding yoga and heart health? Well, the answer is all the above. All the listings listed in A, B, C are correct and valid for yoga and heart disease. And answer to quiz number 2 is also all the above. If you have severe chest pain, feeling lightheaded or chest palpitation, probably these are all symptoms appearing for indicate heart disease. So it was wonderful session having you all here. We come to the end of episode 15 of Health for All. Thank you and hope you enjoyed the session. Stay tuned every Sunday at 8 a.m. The next episode will be on gastro, liver and biliary diseases, causes and symptoms, causes and prevention. Till then, it is me, Shankar Raj, signing off. Goodbye, good day, stay safe and have a wonderful Sunday ahead. Thank you.
Thank you.
Thank you.